Hello, Prashant. Volume. Prashant, raise your voice. हा गणेश हे बघ तुला हा हे करतो सगळे आलेत हा येस
Have you added Ganesh?
हा येस गणेश इज जॉइनिंग आय थिंक जस्ट वेट अ मिनिट या गणेश इज देयर
चिन्मय, मैं सेमिनार में हूँ, मैं बाद में कॉल करूँ, मेरे को अर्जेंट नहीं है तो मैसेज करो अदरवाइज। चलो बाय।
या आवर ओन गणेश एंड आवर ओन निखिल दे हैव जॉइंड हेलो गणेश
Hi, very good evening.
हाय हाय
Hi. Hi,
विदाउट
Samir.
यू विनोद यू
Yes,
यू
yes.
अनम्यूट योरसेल्फ
Okay, so I think we should start today. It's 8
यस
o'clock.
इट इज
So I welcome all the guests who are speakers here, and they are very much experts in our medical legal chapter. I welcome you all as a secretary of IAP Chhatrapati Sambhajinagar branch, and I will now hand over to Ganesh, Dr. Ganesh Kulkarni, for introduction of our speakers.
Good evening. Before I begin, I hope let's have President's remark. So let Abhijit set up the
या
context why we are going to do this program.
या इवन I also welcome all the esteemed faculty today present for this webinar. So we started this webinar last month, and last month there was a huge response, and we hope this time also people will like it, and many of them have shown interest. So this Ellora series we have started, and now this is in collaboration with Medical Legal chapter of IAP. So with this collaboration, we are coming ahead with now we are celebrating Medical Legal Protection Day today, that is 17th of Feb. And for that, we have a theme that medical legal protection is a doctor's right and a patient's benefit. And the slogan of today's Medical Legal Protection Day is legal knowledge, safe practice, that is shielding doctors strong and active. So with this brief introduction, we have our faculty, esteemed faculty in Dr. Bela Verma ma'am. She's having a talk. We have talks of 40 minutes each. And if we get extra time, we'll keep a panel discussion. So we have topics of Dr. Bela Verma ma'am. she is talking on Bharatiya Nyaya Samhita versus IPC. Dr. Samir Sadawarte is talking on certificates and medical legal issues. Dr. Hemant Gangulia sir on basics of medical legal issues, and our own Dr. Nikhil Pathak, who is CIP EB, who is having a talk on general medical legal issues in pediatric practice. So we'll be allotting 40 minutes, 40 to 45 minutes for each, so that we should complete it within 3 hours. And if time permits, we will have a discussion, panel discussion. We have our own Dr. Ganesh Kulkarni as moderator. He has moderated many sessions, and I hope I wish him all the best, because he's very good at conducting all the panel discussions, and he's good at every subject that we know. So I hand over to him, and I ask him to take the proceedings henceforth from him. So you can just introduce everyone and start the session, please. Thank you. Thank you very much.
Thank you, President Abhijit. Indeed, it is a pleasure and honor for me to be here today, and I would be really learning a lot from all these stalwarts. Medical Legal Chapter has been doing a great job since so many years. Recently, we have had one very unfortunate incident that has happened in Chhatrapati Sambhajinagar. It was related to post-operative death of a child. And we all, pediatricians at Aurangabad at large, or Chhatrapati Sambhajinagar at large, are now, we are in a position, or such an awkward position rather, that we want to learn this particular aspect of pediatric practice, so that our practice days become happier days, not the days what we are now facing, the stress of our practice. And that's the reason why this particular medical legal chapter module was ascertained for us. And coming to the stalwarts today, the faculties, the learned faculties for today's program, we have Dr. Bela Verma ma'am, Dr. Hemant Gangulia sir, Dr. Samir Sadawarte sir, and our own Nikhil and Prashant. I'm able to see him also, because Dr. Prashant Jadhav has also a very keen interest in medical legal aspects, and he is an advisor to all of us, all pediatrician colleagues at Aurangabad. So let me introduce first Dr. Bela Verma ma'am. She's been a friend, philosopher, and guide to me all the times. She's been 2 times EB for Central IAP EB in 22-24. She is right now heading the Department of Pediatrics at JJ Medical College, Mumbai. She is, we all know her for her conviction, her straightforwardness, her putting up a subject in her own style, in her own way. So we are very fortunate here to have you, ma'am, today, and welcome you. Then
Thank
we
you.
have another senior pediatrician from Konkan area, that is Dr. Hemant Gangulia sir. He is perhaps known as the stalwart faculty in the field of medical legal. We all know that. I really do not have to say a lot of things for him. He has been instrumental in guiding us in each and every pediatric conference about medical legal aspects. He was chairperson for medical legal chapter. He was chairperson for Mahapedicon in the year 22 or 23, I suppose. And he has been writing a lot of chapters in the medical legal books. So he is kind of an encyclopedia about medical legal aspects of pediatric practice. So I welcome you, sir, for today's module. And the third stalwart, who's a very good friend of mine, Samir Sadawarte, he is actually into a critical care pediatric medicine. He has been awarded as a fellowship of critical care pediatrics from London, and he's right now heading the Department of Critical Care Medicine at Fortis Hospital in Mumbai. But his interest in pediatric medical legal aspects probably has been growing a lot, because he knows he has been facing a lot of critical babies, and he probably must be in a position every time facing some of the other medical legal aspects. So that's the reason why he would be able to really guide us in a very elaborative manner about how to handle the day-to-day problems in pediatric practice. And coming to our own Nikhil, he is a darling of all the crowd here in Aurangabad. All the pediatricians probably love him so much that whatever he says, we listen, we shut our eyes and listen to him. So he's we all are so fond of him. And coming to Dr. Prashant, if he is there, I hope he should be here because he is another person who would enlighten about medical legal aspects. So I hope today we are going to have a wonderful time for next 2 to 3 hours. Whatever questions that are there in the minds of all the pediatricians, practicing pediatricians in Aurangabad, would be able to get the answer, appropriate answer in today's session. So let's begin with. I hand over mic to Dr. Vinod for further proceedings. Thank you for giving me this privilege here. So over to you, Vinod. You unmute yourself first. Unmute yourself, please.
Okay. So Samir, sir, you are giving first, huh? So I will tell Samir sir to start the session and be the first speaker today. So I will go ahead, sir.
So I'm trying to share my slide first. I hope it will visualize now. I'm just making it curve.
Yes, sir. Yes, sir.
Yeah. So tell me if it's visible now.
Yes, sir.
Yeah.
Okay. So let's go ahead. So I'm going to talk about the medical certificate. I must disclose I have interest for the medical legal part, but as a way I'm not having any specific degree for this medical legal part. I am very fascinated with the way Dr. Hemant Gangolia, Dr. Bela Verma, and other teachers, colleagues have spoken previously in the many seminars, workshops, and groups. And I also start getting interest in this part, particularly when I'm working in the intensive care unit. So we'll restrict my talk on the medical certificate today. And as such, medical certificate is a very vast topic and it contains multiple things. But my purpose for today is talk only about the medical certificate related to the pediatrics and particularly for the leave and the certificate of the pediatric death. So I will restrict myself to only these two parts for today. So as a medical certificate, it is a written statement from the physician or from any medical qualified doctor or healthcare provider who actually do the medical exam and write its reports. And this report can be given to the patient party or to the whomsoever it requires. And that's why it is a document one. It is confidential matter. It is very serious matter. It is a legal issue. And that's why it should not be taken as a lightly. It is a platform for a person who is next to it to know what exactly the person has. So whether the patient is fit or unfit, and considering their status of medical condition, whether they can continue the particular job or whether as a pediatrics, whether they are able to join the school or to do routine activities. So basically the medical certificates sometimes are required as a health benefit. As for the insurance claims, sometimes it also used for the disabled parking. We have heard about in most of the places, or even sometimes in the issues related to the mental issues, or for the handicap purposes, for contagious diseases. So it is a vast topic. I'm restricting it myself. Remember, can be challenged in the court of law. So when you talk about the certificates part, I will talk about for what the patient feel and what's the patient perspective. Few slides are taken actually from the internet, the same way what is there mentioned in that one. So I'll go on that first and will show you what patient feels of. So one of the Quora where it mentions by one of the school going child, adolescent, that he has taken a lot of leaves for his preparation and he has attendance of only 70%. And now his school is threatening him. And that's where he comes to know from the teacher itself that get the medical certificate or get the certificate from the illness and show it to us, and then you will get benefit of that. So now he's asking on the internet, can anyone help me trying to get certificate. Another person, parents wants to go for holidays. A child also feel that he wants to go for holidays. Is there any way doctor can help us? Are there any way a doctor can give false certificate? Or like actually a good scenario where child was sick, was taken the treatment 1 month back, and the child was given rest for 3-4 days and was asked to resume activities after shown and follow. But the child and parents lost to follow up, and they come after 1 month. And now at this moment, they're asking for you a leave certificate or sickness certificate. Or sometimes you got the call or actually asked in the OPD, patient is not brought, but parents wants certificate. Or sometimes they are in the other hospital, they want to transfer this patient or they want to do something else, and that's why they want some certificate. Sometimes the parents comes to you for getting the certificate of disability, or actually want their child to go in the special school, and that's why they want the certificate of handicap. Or sometimes the patient has seen before, has recovered, but parents want for some their own benefits to continue showing the sickness, and that's why they also get the benefit of leave, and that's why they want the certificate. So remember, all these places, doctor is not at a fault. It is the parents, patients, and the around areas where they actually forcing the doctor, and doctor sometimes falls prey for this, and that is they get trouble. So as a field, it's a very common practice, it's a routine practice to issue the medical certificate, but actually it comes with some responsibilities, and there are also some ethical and legal requirements for these types of certificates. Rampant violations is commonly seen. Certificates not corroborating with the illnesses has been issued to the parents by the doctors, and that has caused the trouble. So remember, friends, certificate always should follow with some principles, must be have some ethics there, and also to remember there are legal issues and litigations further if goes in the court of law and can be challenged there by the opponent parties. So when so legal document can be questioned in the court, and also this whatever report or certificate is there, it's a confidentiality. It is a right of the child and parents and patient to maintain the confidentiality. So should not be displayed on the area of medias. Also, these certificates are specifically given by the only people who are authorized to give those. Like suppose for a pediatrician can give certificate to the pediatrics. He should not issue the certificate to the adults. Same way for the various telepathies and allopathies are there. It should be given only when request is received from the parents. And generally when parents actually ask for this type of request, this actually comes for the sickness, functionality, and for the dysfunction. But doctor can make the mistake while issuing such type of certificates, and that's why he comes in the fault. Various types of certificate, I can show you certain certificates are there. Most of certificates are internet driven. I actually seen it from somewhere it is mentioned about to whom should it concern. Remember, it should not be mentioned like this way, because you are issuing these certificates for specific reasons. Actually, child is sick and not going to school. So the school teacher or the principal wants for the particular type of certificate. So there is no need to write to whom so it concern. It is not for the common people or around people or surrounding people or for the social media to show these certificates. Sometimes certificate doesn't mention about the date, time. Again, that is wrong because we need to have certain things. So in my next few slides, I'm going to talk about how the model certificate should be seen and what are the guidelines are there and what are the things, mistakes done by the doctor and how you can rectify and decrease these errors, and also to understand what are the legal issues about this. So certificate format should be in the form. It is like information about a medical illness or issues has been provided. For that, the doctor should have his name, his qualification mentioned. Only the MCI or National Medical Commission mentioned those qualifications should be sent there. It should also contain the details about the practice where the doctor is doing. Maybe his official practice, maybe he's at office or he work in some particular institute. So that hospital address and dispensary address should be there. Very important, we always forgot. And I'm going to stuck on this part. I have this slide on 2-3 times. Patient signature or his identification mark is compulsory. So suppose it's a child, it's a parent's signature has to be compulsory. And second thing, identify particular marks like a moles or some sign of injury, some permanent marks, something like that, which is identical for the child. Has to be mentioned, at least 2 in numbers. Or simply taking the thumb impression in some cases has been also allowed. Certificate must be in the form of serial certificate. Like suppose you have a series of 100 certificates with you, and suppose somebody you given yesterday and today you give another certificate. So the number will be, suppose yesterday was 45, 46, now today comes 47, 48, like that way. So it should be a serial number. Serial number has a lot of authenticity. In fact, many of the litigations where the judge was very careful and very knowing to know the facts, and he was very experienced, and he actually asked for the serial numbers, which the doctor was failed to give, and that's the only way actually he gets litigation about that. Handwriting, the way we are writing our notes, signatures, dates, time, diagnosis, it is, in fact, recently also one of the judge actually asked for how this error can be reduced. So possibility that you are recording, writing things can make a evil in the death. So how you prepare for yourself? So as soon as the patient's party comes to you and actually asks for certificate, remember, this is a legible and facts actually has to be seen by doctor previously. So patient has been seen by doctor, parents want certificate, you carefully check the patient, identify the patient, is a correct patient. Many times you have a couple of 3 or 4 kids are there. And then sickness, the certificate can be given to other child or other patient's name, some error happen. So to prevent this one, check for and identify for the particular marks are there. Obtain the patient history, and if the patient history is very significant, that also has to be mentioned. So it's not like the child is suffering from the pneumonia and I advise him for 3 days rest. No, you should always mention the child comes with the complaints of the fast breathing, he has respiratory distress, or he is recovered from this one. He has received antibiotics for so many days, and now I have given him rest for 5 days. After 5 days, now today, I am finding he's medically fit and he can resume for the school. So it should be a very detailed way, must include history, clinical features, and diagnosis has to be there. So sometimes you might require to have some evidences and investigation report for you. Identify marks is compulsory. Issuing certificate has always ethical and medical issues there. Certain things are very mandatory. And one of that is like a doctor should mention his name, immediately followed by his degrees, followed by his registration number. There should be 2 different numbers. One is, of course, is the Maharashtra Medical Council numbers you have. You should have that number, particularly if you people are from the Maharashtra. Only recognized degree and certificate has to be shown. You don't need to mention about the non-specific, non-medical degrees here. How to use certificate, you can mention is like a sick note or evidence of the condition of health. A false certificate can land you in a disciplinary action in the civil code or in the Medical Council of India, in the Maharashtra Medical Council. So use very judiciously. Mandatory inclusions, I already mentioned about patient identification marks. Don't mention, there is no need that I am knowing this patient from birth, or I am knowing this patient from 5 to 10 years, and now he was never performed the sick. First time he becomes sick. Unnecessary detail. There are no need. You have very small paper, 1 page, F4 size preferably to be used, and you should have your details of that. Mention very specific things which are required, may be useful for you to prevent litigations later on. Patient signature, thumb impression, visible scar, birthmarks, definitely going to help you. Maintaining of the records. And that's why I'm insisting you that you should have a serial numbers, like suppose 1 to 200 with you, and should keep the records of this type of pictures for you for longer period. There may be issues for how many days you need to keep it. But remember, better you keep it for some time with you. Examine the patient, always write about the date and time. So sometimes the court or even the school can ask, apart from medical certificate, please show us the other reports of the patient to prove as a proof. and sometimes you forgot to mention about date and time. But specifically, actually, the purpose for asking for such certificate, you should always mention on the paper. So, like suppose to start, resume the schools again after brief period of illness. But that was the reference purpose, and that's why we are issuing the certificate. Your handwriting should be legible. Signature should be complete, as like you have in the passport or as like you have in the PAN card. It should be complete signature, not just like an initial or whatever something has been done. No, it is incorrect. Keep the Xerox copies, supported documents. Sometimes you have to keep with yourself like X-rays, paper reports for longer time with you. Always never give beyond 15 days. Like suppose we are giving for the sick leave or for the leave purpose. So that should not be more than 15 days. If after 15 days the child is still sick, something is wrong. Either the parents might be more cautious and that's why they have not sent the child and they want further off. Child is absolutely normal. So absolutely in such cases, you must not issue certificate. Counsel the parent. Try to find out the reason why they are actually asking for more off. Retain records preferably for the 3 years. Essential components, it must be on your letterhead. It should not be like a common letterhead of the hospital. I have seen like many tertiary care hospitals or polyclinic. They have a very simple format, computer format. There is no name written. There is just like a stamp. You must have your letterhead of your own name. It must mention time, place, person, date, patient information, patient-related injury and illnesses. Clear diagnosis. It's not like the child is suffering from illness and that's why I want for 5 days off. No. You should mention very clearly, child is suffering from the pneumonia, now has recovered and now is treated for 3 days and now is ready to go for the school, resume the normal work or cannot resume the normal work, cannot resume the outdoor activities. Like simple way you can written on that one. Sometimes you have to mention about particular types of protocols or environment safety or child safety. So suppose the child is injured for something and related to the work, please mention that this has happened particular areas because that is also sometimes required as a part of insurance purposes or as a part of the hospital or as a part of the school benefit related. So clearly mention whether the injury to the particular patient, whether it's causing restriction of the activities. If it's yes, again, sometimes in some places you require from the government hospital or government doctors to prove certain types of disabilities and handicaps. Ayurvedan medical consultant is long back means old paper in 2013, where first time they realized that why identification marks are important. So it is mentioned very clearly here. If you see, to be filled in applicant in presence of medical attendant or medical practitioner, identify marks 1 and 2. Only once you do this, then you proceed further and mention about that I have examined this patient very carefully and is suffering from this disease. He was suffering from particular illness from this time to this date and now is ready to restore for his health, go for the school. So nature and probable duration of illness has to be specified in the particular certificate. Whatever you are writing, it's your responsibility. So sometimes it can be misspelled somewhere and you land up in the trouble. Medicolegal consideration, if your certificate is there, it should show some degree of disability if something is there. But obviously you have to mention that this degree of severity or disability can get changed as the time prognosis happens. So what is the prognosis of such type of illnesses and what is the recommendation? Is the additional add-on event that should be put in the medical legal consideration. So what is the best practice as a part of a healthcare worker? As a doctor you are, it should be complete. It should mention timelines. It is a confidential matter. You have to keep it stored and retrieval. So proper things has to be done every time. Always write the full diagnosis, preserve the test, avoid jargons and abbreviations particularly, because sometimes that can be misspelled or misused, or sometimes it can causes error. And actually this causes litigations for the doctor later on. Keep the written copy. So actually it should be as a Xerox or it should be like your copywriting and it should get the automatically written on the carbon. So carbon copy. On this carbon copy or on the Xerox copy, you should mention and take preferably parent signature. Both the parent signature is better. And remember, it should be given only to the authorized person, not to the third party. So sometimes the patient is admitted under your care, and there is always mentioned next of kin. The name is written is the responsible person. So only that person is supposed to take. It always should be a parent, one of the parent. A medical practitioner, we should know what is we are. We are a responsible profession. We are like a gazetted officer, and our signature, our certificate has a great value. So always one should be very suspicious and has to have vigilance, because every patient can go in the litigations and can misuse your papers and documents. Whenever parents ask you for particular reasons, you always ask why the reason for getting such type of certificates. Sometimes the parents get certificate very easily for their children, and they show for their own issues a simple way that child was sick and that's why I remain absent. So be careful. A pediatrician has to be more cautious on this part. Do not give certificate in certain cases. I'm showing to you certain things where never give more than 15 days. If doctor is not trained in particular area or particular type of illnesses, and his specialty is different. Sometimes you are a general pediatrician, you are limited to certain things. If you are an intensivist, if you are a cardiologist, you can use specific type of certificates. But if you are not specialized, if you are not taken training, and if you are not knowing, don't use such type of certificates of other pathies. If somebody already seen this patient, now this patient comes to you, right? That somebody else has, physician has seen this doctor was different, and now they comes to you for fitness. Again, something false play might be there. Do not contradict. If somebody has given particular type of certificate, now parents comes to you and say, accuse the other patient doctor saying that he was wrong, something was wrong. Now give a certificate. This child has this type of illness, this type of problems. This is again a problem for yourself. You land up yourself in the trouble. It's like Abel Muzema. You don't fall in such prey. Doctor, we are very responsible people. So we have to be very careful. You must address certificate for a particular person, like suppose for the principal or in the class teacher of the school. You please mention the name of the principal if you know, or simply write to the principal XYZ school, address of that school. Because again, there are 3-4 types of schools of the same name. So if preferably to mention same thing, your child of standard 6th A was admitted in our hospital, was seen by me 2 days before, and I asked him for rest. Now he's fit. So there are 2 different types of the certificate. One is sickness certificate, another is fitness certificate. Don't give fitness certificate on the day when you see the patient for the first time and you mention here the bed rest. So parents will say to you, okay, I don't want to come again because it's very far for me, or as a part of getting like easiness for me. Please, today Saturday, I am going to send my child to Monday. So don't issue certificate of the Monday on Saturday itself. You should have different certificate for the different thing. It's not like the complete should come in the one certificate. Don't write whomsoever. Again, whomsoever has a very particular meaning. It means anybody can use that. That is the meaning of that whomsoever. So that can be used by anyone. You very specifically mention particular name, it will restrict to that particular name only. Never give backdated certificate. Somebody will come to you, as I mentioned previously, a child was admitted with you 1 month back and now comes back and asking for the certificate. Or some known people, most of the times your own relatives will come to you. Or you are known to them, you are remain in the same society, you have good friendship with them. Friendship is friendship, legal matter is legal matter. You are a doctor, you are a responsible person. You should not give fake certificate. Never give fitness certificate in advance or in the back date. Physical presence of the patient is compulsory. Sometimes happens, child was seen 5 days before. Now parents comes to you, child is much better. He has gone to school, school asked for a certificate. That's why I come to the school. Sometimes you may find in trouble. Actually, something has happened differently. Wrong thing has happened. Be careful. So somebody asks for fitness. It's not like fitness is always to be given. You can argue, you can check, you can see the patient carefully, find out the things why particular patient is asking for fitness certificate. So fitness has to be checked, documented, and also clinical as well as way you should do some investigations. Like suppose for sports, sometimes the parents can come that school has asked for you the sports certificate for fitness certificate. Be careful. We have seen lot of patients getting problems, particularly on the field track, swimming pool, on the outdoor activities. They fainted. They have got some other issue. But because you have mentioned the child was fit, ultimately it comes to you. Be careful while sending the reports. Medical certificate is a legal document. Issue misleading issues, inaccurate certificate actually can cause you trouble under regulation acts from the medical council. And this is a professional conduct ethics board mentioned in 2002 that false certificate can cause you a legal related issues. So only registered medical practitioner, that you are a medical legal practitioner, you are a pediatrician, you have degrees, you are qualified to practice pediatric medicine. Yes, you can give certificate of fitness. Again, fitness, whether you ask for physical fitness, mental fitness, sport fitness, be careful of writing the way. Employee Act, which was mentioned about in 1972 in the Central Civil Services Leaves Act, employee can have maximum 15 days of paid leaves. More illnesses, they can ask for even 24 hours leaves, but it is not in your hand as a pediatrician. These certificates are done by very specific type of boards from the government areas, from the civil surgeons, or from the medical colleges. So should not be issued such type of certificates to the parents. To prevent the misuse of your certificates, always keep your letterheads, pads, programs, your things inside the lockers or very specific areas, and keep your official seal and stamp. Registration number, details, stamp, everything should be kept in a separate place. Should not be used by anyone. You should not allow your junior doctors or nurse or anybody to use your own stamp or your own papers for any reasons. Always remember, it's your signature which is important, it's your paper is important. Look for very specific things. Again, I spoke about this part. Again, I repeat it. Clear dated signature. You have to have very clear signature. Sometimes you can have QR code. Nowadays, you see, we are going in the digital area and e-certificates are available. So the QR codes mention about particular things, particular numbers, identifying numbers are there. Sometimes your digital signatures are there. Yes, you can utilize this part, but be careful. You should know the advancement of this part. And again, it should be come with your own passwords there. Otherwise, somebody can misuse it. Most common way of misusing of your own papers are by your own colleagues. Common red flag signs, if you find some misconduct, some inconsistency in information, or different parents are talking about different things, be careful while giving the certificate. Never give fake certificates. I already mentioned about this thing. I will just skip it. So you are giving the certificate for purpose, very particular purpose is there. Sometimes the certificates are issued because they have disability for renewal of licenses. Again, fortunately for pediatrics, this is not the part. But as a pediatrician, you should be aware that you are now up to 18 years. You can see the patient party. Legality and authenticity. Your document of certificate is a legal document, diagnosis, treatment. It should be there, and criminal offenses can be formed if you have done the forgery of the things. Taking sick leave when not sick by the parents, thus they want to extend their weekends, holidays, and vacations. But on behalf of what? You are actually getting trouble. So abuse of the sick leaves are always done by the parents and relatives. We should be very careful on this one. Never do these terms. You don't need to do this. Say clearly no. Sick people may not be sick actually. Sick child now has recovered. So parents are getting mentally sick. That is not your job to worry for. You remember, by doing the sick leaves, extending sick leaves, and giving forgery documents, actually you are troubling the whole community, whole India. You are reducing our productivity and profitability and team morale also. So strain management relations, mistrusted policies, keep in mind, you are a doctor, you are a responsible person. False certificates in the form having sick leaves or giving work-related injuries. You have got actually accident on the road, but now you are giving certificates saying that injury happens in the own place or workplace, and thus getting more benefit, again, that will cause you land up in trouble. Somebody might have taken the certain photographs, videos, or something you may not know. And you will land up in trouble because the way you have written your notes and mention the certificates. False fitness certificates, employment, travel, sports participations. Please be careful. Don't issue certificates unwisely. Second part I will talk about is I think I have 10 minutes. I will finish it in fast. False, like a cause of death. When doctor patients comes to you that this was your old patient, now he's died, please give certificate. If this patient is not seen by you in last 13, 14 days and is not under your care, you are never seen or never unknown or remembering now this patient, avoid giving certificate to these people. Sometimes parents want certificate, now they realize later on that they have some insurance claim, some inheritance, some criminal investigations. They want the fake certificate. Never give. Remember, you have a lot of criminal offenses and Dr. Bella Madam is going to talk about this one. So I'll finish in briefly because these are old IPC sections. There comes with a now new IS Sahinta. So fabrication certificates is section 193. Please read it about it very carefully. Evidence Act, false evidence can land up you in 190th section for almost a fine and sentence of up to 2 to 3 years. And there are many punishable offenses are there. So don't go for all these ones. Forgery can go land up you in the imprisonment and fine. Prevention of the Corruption Act is also there in 1998. So that is also keep in mind as a doctor. So medical negligence, fraud, loss of license, civil liability, disciplinary actions, insurance-related claim problems, all these things can be a possibility in near future for a doctor if they give false certificate. So preventive strategies, how we can prevent ourselves? Be honest with yourself. Have the moral and ethics for yourself. Follow standard procedures. Maintain the detailed records. Ask for second opinion. If sometimes you are doubt, please ask the parents, I am not getting correct things. Better get to some additional opinion. And remember, report suspicious activities to the social issues. Death certificate, I have 4 or 5 slides here. And I have one homework for all the people who are listening here. So when you're writing death certificate, you have to be very particular and very careful. If he is under your care, definitely you have to write and you are responsible for the writing the death and death certificate and death summary. Death certificate and death summary is different things. As a part of, like, I work in the Mumbai, so we have Municipal Corporation of Greater Mumbai as a part. Various section have 4 or section 4A, whether you are working in the hospital, whether it's in the OPD practice. But whatever way, few things are common for all. Do not mention the way of dying. Like suppose somebody died because of cardiac failure, respiratory failure as a last event. It is a last event. But why this has happened? Like what is interest is not the respiratory failure or not the cardiac failure or not the terminal cardiac respiratory arrest. Terminal cardiac respiratory arrest is not the diagnosis. Please never write this. Also, not the clear diagnosis like a diabetes. Diabetes is a complication. So you can write this in the third part. I'll go on these details on this one in my next few slides. Remember, you have to complete all the columns. Also on the right side is mentioned about the onset, duration, progression, and death. Please fill up that form very clearly. Like let's see, I don't know whether you're able to see this form. So here you mentioned about the cause of death. Initial part is like a name of decades. Timing has to be very careful. It should be like your check. Like what you write in the check, even a single mistake, you throw this certificate, take the new certificate. No mistake is allowed. No overwriting is allowed. Writing the cause of death, the first column mentions here immediate death. So immediate death, you have to mention the reason for that, not the mode of death. Second part, it contains antecedent causes. Like what are the morbid conditions? You can write in this case like a malignancy, carcinoma, or something like a diabetes mellitus, or some like a progressive disorder. All these things comes here. Then you can have sometimes morbid conditions, particularly like a pediatric child. He can be suffering with a malnutrition from particular types of syndromes where the quality of life is not there, or as such the way is ultimately death. So in this case, it comes in addition to additional significant conditions. Like suppose sometimes you can have hypertension or related things, or like a diabetes which is not provided in the initial part. So here you can mention about this part. Again comes manner of death: natural, accidental, suicidal, homicidal. Remember, only natural way you can write. If it is a think of suicide, homicide, in such patients, you require postmortem. Don't issue certificate as such. Female child, sometimes you have seen a lot of time antisocial activity happens, and the female less than 18 years, and sometimes you can have pregnancy there. Be careful. POCSO Act is also additionally there. While giving certificate, you have to be very careful on giving such certificates to the patient party. So here I am just talking about the medical certification of cause of death. It is the form number 4. Form number 4 is particularly for the admitted patient. Form number 4A is there, that is for the not admitted patient. But again, that will be more for the adult purpose, not for the pediatric patients. So in more details, you can see everybody has seen such type of forms with them. I'll just go in further ahead. So disease or condition directly leading to the death. So you have to mention this part in the A. Why and as a consequence of what this has happened. So it comes antecedent cause, like a morbidity condition. And sometimes you not have the direct cause of the death, but contributed to death. That comes in the part 2. The lower part is also important, where you require it for the purpose of having things that is for the records of the hospital and records for the parents. Sometimes you can have form 4 and form 4A as I already mentioned here. So you can utilize such type of forms also. Cause of death, as already mentioned on the back side of your certificate, you can take the help. Never write heart failure or respiratory failure as a cause of death or as a cause of initial part. Always mention about the onset. Suppose it's a newborn, your onset may be from the birth or soon after birth. Or if suppose the child died at 4 or 5 years, the onset actually having started with like patient having cystic fibrosis, maybe from the several years. So mention it very carefully, the way you write. So death certificate should mention disease condition directly causing the death. Like suppose I can write refractory congestive cardiac failure, septic shock, comorbid conditions, why it has happened. I will not write cardiopulmonary arrest at any place in this case. You should have always a clear and legible handwriting. No mistake about age, sex, name, or anywhere on your death certificate. Any mistake is better always to rewrite again on the next page or on the next number, serial number which is there. Death certificate is issued free of charge, not to be withheld for pending fees. I have seen and I have heard about that many hospitals has not given the certificate to the parents or relatives because they are not paid the money. Again, this is an entirely different situation. I'm not going to talk about it for today. Only single copy, never issue duplicate also. Please tell the parents, give them Xerox, that's okay. But original certificate is always only one. Always maintain a carbon copy with your own records. So one carbon copy you can give extra to the parent because they might require it for the funeral and other purposes. Sometimes you also require original certificate for the giving to the BMC as per in the greater part of Mumbai. Death certificate should issue by only medical registered practitioner who should have particular degrees in his hand and should be attended this patient in the last 14 days. Preferably at the date of the day, you should see this patient. So you can give this certificate. It's under your care. It is your responsibility now to give this certificate. And you must be satisfied about yourself. It might have happened the child is having some other issues. Patient comes to you and he dying because of septicemia. But original way he comes to the hospital was some different issues. So be careful of writing the notes. And if you have any trouble, use the help of a medical legal consultant, or might be your hospital has certain ethics and related legal parties. You can take the help of them. While giving certificate, be careful. Don't give certificate for the patient who comes broad dead or intraoperative death or has happened because of burn, poisoning, or like a medical legal case, because such patients will require postmortem. So just taking the sign that you parent don't want in postmortem is not enough. Same parents can come back again to you and sue you from the because of the lawyer that such certificate this was a medical legal case and you have not given us the medical certificate. Let's see one example. I want inputs of the people around here. A 4-year-old, these are last 2 slides. 4 days old preterm child come with you. I'm so sorry for that. Okay, now can see. 4 days preterm child with a cleft lip, cleft palate, along with hypoplasia of genitalia, with multiple congenital anomalies. Baby becomes sudden breathlessness, cyanosis after feeding, suggestion of aspiration pneumonia. Child died after 4 hours. So it's a 4 days old child. So what is come in the A? Are you with me, guys? Hello?
Aspiration pneumonia. Aspiration pneumonia.
So what is the A? I also don't know very real cause, but this is a real study I actually taken on the internet and with the Dr. Hemant Gangolia's slide actually. Dr. Gangulia, are you there?
I am there.
Cause of death.
So please
A is
continue. I have
aspiration
taken, I
pneumonia.
have taken your permission.
Aspiration pneumonia.
Let people say.
Yeah.
Correct.
So what is the A?
I don't think we want all of them to say together. That's why.
What is A?
Okay,
What
sir.
is B?
So
and
madam
A
is
is
right.
aspiration
So it is
pneumonia.
the aspiration, that is the immediate cause of death. So as definitely well said by madam,
A.
Bella madam, that is correct. It is the aspiration pneumonia comes as a part of A. Now comes the second as a consequence of. Here you can write multiple congenital anomalies, cleft lip, cleft palate, all these things can be happens here. Any significant cause, if something there like a suppose born prematurely or something, if you know additionally, you can mention. Now comes the interval. So internal cause here is not the 4 hours, is not a 4 days because it's a 4 day child. So immediate cause aspirin pneumonia happens from the time parents give the history. Like parent give history 4 hours before. So now that's why it is mentioned child died after 4 hours. So it comes here incidence and death occurrence as 4 hours and antecedent cause. Here it comes 4 days. Thank you. Next slide. 7 years old. This is last slide. 7 years old male child referred from remote village hospital because of vomiting and loose motions for 2 days. Now this patient has severe dehydration and was in hypovolemic shock. Immediately he was treated vigorously with IV fluids, antibacterial and stool sample was sent. But he was not revived because of irreversible shock and died due to gastroenteritis on day 3 of admission. So now let's see what comes in a cause of death. Anybody around?
Hypovolemic shock.
Okay, so if you write hypovolemic shock and A, as a consequence of what?
Gastroenteritis.
Gastroenteritis.
So here is mentioned severe dehydration. So severe gastroenteritis with hypovolemic shock. So what is A, B, and C?
It's
If you're not able to give
irreversible hypovolemic shock in A due to
yes.
acute gastroenteritis or severe gastroenteritis.
Okay.
And sepsis, maybe because you're saying antibacterial agents, and actually a pure gastroenteritis improves within 24-48 hours with proper fluid therapy, unless there's a systemic illness with it, where there is a background systemic illness where the child usually may succumb.
But is it mandatory to write
No, it is
C
not
if it
mandatory
is?
to write the C always. But
Yeah.
if you know additional causes, additional things, like suppose this child has developed from the SAM, acute malnutrition, or something additional history is there, you
Yeah.
can mention it in the type of the C. Or
Okay.
previously non-vaccinated or something like that, patient has developed some additional part, comorbidity additionally, or some syndrome is there, you can definitely mention that is a contributing factor, but it may not be the actual cause of the death. So thank you very much. Thanks to Mahesh Baldwar sir, Hemant Gangulia sir, Satish Sharma sir, J.K. Gupta ji, Ellora madam, Satish Tiwari sir, and Ashish Jain, whose input has been taken in making these slides. Thank you very much, and I will stop my sharing also.
Thank you, Samir. Thank you indeed. That was a very precise elaboration. I never thought writing certificates has so many implications. No? So we got to know point-wise. First thing that I liked was we should know when not to give a certificate and whom not to give a certificate. That's the first thing. Second thing is when we have decided to give a certificate, we must know what content it is going to have and to whom to address it, the specific person whom to address it, not
Yes.
whomsoever may concern.
Yeah.
And when we want to frame the content, we must know whether it is in our jurisdiction, whether it is in my capacity to give it. Like I am a pediatrician, so I should not comment on something which a cardiologic illness or a mental health illness or something like that. Or if I'm a pediatrician and doing a private practice, then I'm not entitled to give a disability certificate beyond certain percentage. So these are the contents that I should know before writing. So I should first frame the content, and if it is okay, then I should be able to write. And when I'm writing the certificate, as you rightly said, there should not be any legible or the abbreviations which we have an often habit of writing those abbreviations. We should not write those abbreviations which are not known to the world on all the certificates. There should not be overwriting. There should not be any rewriting, something like that. So the certificate becomes invalid. So these are the few take-home things. And the last part, what you talked about writing death certificates, we all have written a lot of death certificates, but now I remember, and when I look into whatever I have written for so many years, I definitely have learned a step ahead. Thank you for that. Thank you so much.
Thank you.
Okay. Thank you, sir, Samir sir, for your excellent speech on this certificate. What we think it is a simple thing to give to the patient immediately. And I will now invite Dr. Bela Verma, madam, and she will be talking about Indian Penal Code versus Bharatiya Nyaya Sanhita. We know that Indian Penal Code has been changed now to Bharatiya Nyaya Sanhita. So I will invite Dr. Bela Verma, madam.
Good evening, everyone, and Dr. Samir, what an excellent talk. I'm going to hear it once again if you share it with me. So,
yes, madam, surely.
I have been given this difficult task of talking on the IPC versus the BNS Act, which we all must know. Ironically, many of us don't even know what the IPC was when it existed, and that includes me. I'm an ignoramus in that sense, unless I realize the medical legal issues, and for that, I've been an active member and taking part in trying to disseminate the knowledge. So we are going to see what was the previous Indian Penal Code, which never had a section on medical profession at all. It was just a list of crime along with the punishments attributed to those crimes. But now, in 2024, this has changed to the Bharatiya Nyaya Sanhita 2023, came into effect on 1st July 2024, where there is a dedicated section on medical negligence. Since there is no case as yet as a precedence in the jurisdiction, we do not have examples to cite for BNS. As and when the cases come up in courts and we see what the court of law decides, we will have examples of cases for BNS also. So what has changed in IPC and converted into BNS for us? We have to know this to improve our practice and prevent medical legal issues. Unfortunately, there is a silent epidemic of medical negligence which is quite widespread, and there are often hidden dangers. We all know that, from misdiagnosis to botched up surgeries to poor documentation. We are liable for everything, and the noose is only tightened around our neck by the law. What the BNS unfolds, how good it is for us, or how it is worse than the IPC, we will see in the coming talk. I have tried to simplify it. It is a difficult topic. I have been reading it for the last 4 months because I spoke on it in the Pedicon also. So I'll try to do my best, and I'm sure Dr. Hemant Gangolia sir is here. If I make a mistake, he'll be there to help me and correct me. So what I'm going to talk upon is the medical legal negligence first. Let me first explain to you all what is medical negligence. Do we all know what it is? What has changed in the IPC? What are the new criminal laws and prosecution for the medical negligence in the BNS, and how does it impact the registered medical practitioner? So medical negligence is those cases which can be civil cases or criminal cases registered against us, including the consumer court cases. And In the Indian Court of Law, medical negligence is defined as the breach of duty of medical care by a physician or a surgeon which leads to harm or injury to the patient, which can be physical, emotional, or financial injury. This breach of duty can occur through an act of omission or an act of commission, which I will explain in the coming slides. And medical negligence can lead to civil or criminal litigations or complaint, including consumer courts, which results in legal action against us. So to be aware, what we need to do to prevent this is be aware first, know all the nuances, demand accountability, promote best practices among our colleagues. That is how we can ensure a safer, reliable medical healthcare for everyone. Now, jurisprudential concept of negligence, the judges or the court of law will judge the conduct of any physician or surgeon by comparing it with that of a hypothetical ordinary man in that situation. So that is our benchmark of judgment now, that what is the standard of care which we gave to the patient. It has to be a reasonable standard of care and reasonable skill exercised by the treating RMP. So nobody is telling you to do very high-fi things, but what is relevant, prevalent for the times, not even outdated treatments. What is relevant treatment for today? If that has been instituted reasonably, it is not constituted as negligence by the court of law. Please remember this. Higher the degree of the pay of the doctor, so a super specialist, a higher degree of skill is expected from that super specialist, and higher is a degree of punishment for them. So please understand, a super specialist has more responsibilities than a general physician. Negligence is a breach of duty caused by the omission which a reasonable man, guided by those considerations which ordinarily regulate the conduct of human affairs, would do, or which a reasonable man would not do. That is an act of omission or an act of commission. So giving an example of act of omission, suppose a child is brought to you with a dog bite. You know you're supposed to give the anti-rabies vaccine or even the monoclonal antibody along with the TT. But you just give the tetanus toxoid and send that patient away, and then he dies of rabies. This is an act of omission. Ordinarily, the doctor should have given him the anti-rabies vaccine. Act of commission, you are operating upon that patient and you have left a mop inside, or you have left a scissor inside. You have committed a wrong act. Seema. So that is an act of commission. That is what a reasonable man would not do. Before you suture up a patient, you are supposed to check and count your instruments outside, count the mops outside, but you have done it. Similarly, operating on the wrong eye, operating on the wrong limb, all these things are act of commission. Please understand, act of omission and act of commission, they are all liable as medical negligence. What does not constitute medical negligence? This is equally important to know. If a medical profession acted in good faith to save a patient's life in an emergency situation, they may not be considered negligent by the court of law. You may have not noticed many road traffic accidents doctors are reluctant to treat because they think they will be ensnared in that entire legal angle. They will be called multiple times to the court, and therefore they do not want to do that, or they'll be called by the police. But if you have acted in a good faith to save a patient's life, please understand it will not be medical negligence. What other therapeutic privilege we have? If there is a difference of opinion between two treating doctors, or I have made a reference, he has different opinion, I have a different opinion, that is not medical negligence. And lastly, if there has been an error of judgment, I could not diagnose X, Y, Z illness, but I have given reasonable standard of care. I have tried my best to save that patient. It may not be considered negligence by the court of law. Now, 3 new bills have been passed with effect from the 1st of July 2024. Please understand, I am going to concentrate only on 3 or 4 things to focus and drive the message to each one of you. Don't get overwhelmed by these BNS and IPS. Just remember a few laws pertaining for your own good practice. So the IPC 45 of 1860 has now become the Bharatiya Nyaya Sanhita 2023, known as BNS. The Code of Criminal Procedure has now become the Bharatiya Nyaya Suraksha Sanhita, except relating to the BNS 1062. And the Indian Evidence Act has now become the Bharatiya Saksha Adhiniyam, BSA, which does not really have much for the medical profession. So what's out? The IPC 1860 is out. The chapter 23 is out. Total sections in this were 511. And what is new now? The BNS 2023, which has 20 chapters. Now they have been condensed into 358 chapters only, sections only. But there's an increase in punishment. There's an increase in fine. Please remember that. And as I told you, in IPC, there was no dedicated section for us. What was extrapolated to us was negligence, which is actually the rash and negligent driving. But now we have something dedicated to us known as medical negligence. So therefore, we ought to know that. Other things that have been added are the offenses against the women and children are consolidated, and now they are stepped up into a chapter. First, they were all scattered. Now they have become consolidated into chapter 5. So more importance is given to children and women. The BNS section 2 says that child is defined as any child or girl or boy or other gender into less than 18 years. The section 1061 is applicable to us, which I will explain. BNS section 1173 is stringent punishment for grievous hurt with 10 years of life imprisonment, which I'm going to explain. Section BNS 304 has been added, which is snatching. 324, which says offense of mischief, has been expanded. So let us focus on 3. BNS 1061, BNS 1173, BNSS 173, subsection 3. I'm going to be focusing on this and help you to understand it better. Remember, the most important things here are IPC 302 was murder, which was non-bailable. You remember Dr. Archana of Rajasthan, the obstetrician which committed suicide. She was booked under IPC 302. She panicked and she committed suicide. But now this is changed to 103, which is a bailable offense. We are no longer under the 302. IPC section 304 was culpable homicide not amounting to murder, was a non-bailable offense. Now it is under 105, which is again a bailable offense. IPC 304A, which was rash and negligent act during driving, which was being extrapolated to us as rash and negligent treatment giving rise to death, is now become BNS 1061. Still amounts to death by negligence. It's a bailable or warrant, but it has 2 years imprisonment plus fine. So we have to remember this. And please do not panic. There are other ways also where we can resort to for our defense. I will just elaborate section 1061 because it's very important. Whoever causes death of any person by doing rash negligent act not amounting to culpable homicide shall be punished with imprisonment of either description for a period which may extend up to 5 years and shall also be liable to fine. And if such an act is done by a registered medical practitioner while performing a medical or a surgical procedure, shall be punished with imprisonment of either description for a term which may extend to 2 years and also liable to fine. So first it was for 5 years, but with the intervention of the IMA, it has now been brought down to 2 years and a fine. Earlier, there was imprisonment plus or minus fine. But now there is 2 years imprisonment plus a fine for any rash negligent management or treatment which has amounted to death. So a registered medical practitioner, this terminology or definition did not exist earlier in the IPC. But the BNS has now defined who is an RMP, a medical professional who possesses a medical qualification recognized under the National Medical Commission Act of 2019 and whose name is entered in the National Medical Register or State Medical Register. Now there is a rider to it, which we will see in the next slide. And 1062 was the death of a person by rash and negligent driving by a vehicle, means the driver who has run away, committed a homicide and run away after the incidents. And if he is caught, he would be punished with imprisonment. Now, this was applicable, which has been withdrawn. It is in suspended animation and it is not yet implemented. But 1062 does not apply to medical profession. So let us only look at 1061. Some of the sections which remain unanswered are: should medical negligence which has not resulted in death, should it not be covered under the criminal law? What about death due to rash and negligent act done by an RMP during conservative management? We did not do any medical or surgical procedure, but there was conservative management and the patient died. So what happens then? Should the medical practitioner who are not registered with NMC, like the Ayush doctors, dentists, interns, now they are registered under their own councils. They are not under the NMC perhaps. What happens to them? So we all employ Ayush people. We all have interns. We have dentists. So these are the unanswered questions or the drawbacks, which we will see to as the time unfolds, and if such case arise, we will come to know. Now 1061 gives a punishment of 2 years term, which remains the same as before. The 5 years was brought down, and fine is mandatory, and this is a bailable or a cognizable offense. So we have to be careful about it. Hurt and grievous medical negligence cases without death. So example, suppose there's a loss of limb, loss of vision, loss of hearing, or disfigurement. Suppose someone gives an injection in the wrong quadrant of the gluteus, and the child has a sciatic nerve paralysis and cannot move the lower limb. What will happen then? So there you have these BNS section 114 to 118, that is hurt and grievous hurt, and BNS section 116, where there is duration of pain, that is grievous hurt is reduced to 15 days. So BNS section 1173 is a stringent punishment in permanent disability or persistent vegetative state up to 10 years, where the punishment is of more than 3 years. So it does not apply to the 1061. Ironically, it is not there. So if there is death by medical rash negligence, you have straight away got 2 years and fine. And if it is a negligent case leading to permanent disability, disfigurement, it is 10 years imprisonment. These two are not coinciding with each other. We are back to square one. Next is 1173, which I said 10 years of life imprisonment does not help us with 1061. Let us see what happens if there is any case and someone argues it out in the court of law. Bharatiya Nyaya Suraksha Sanhita BNSS. This is an important one which you should remember, because now a preliminary inquiry has become mandatory for offenses having punishments of more than 3 or 7 years, 3 to 7 years. So if there is a grievous injury or even death, we can ask for preliminary inquiry. FIR cannot be launched by any police station directly to arrest any doctor. So we have this clause of preliminary inquiry under the BNS section 173. Ironically, it applies to punishments more than 3 to 7 years, 3 to more than or equal to 3 years to 7 years. Again, does not apply to BNS 1061. Now, wrongful restraint and wrongful confinement. So BNS section 126, which is wrongful restraint, and BNS section 127, which is wrongful confinement. Patient cannot be detained on the grounds of non-payment of bill. And BNS section 130 to 131, which is assault. A patient cannot be touched without consent. These have been introduced. Please learn about them. Seema, 5 minute ruk ja. Murder or medical negligence. So BNS section 103, which was murder, 302 was life imprisonment. Now BNS section 105, these are your better ones. So 103, 105 are the non-bailable ones, which I already told you earlier, and they have replaced IPC 302 and IPC 304. Only section 1061, death by negligence, for 2 years plus fine. Forgery and cheating have been introduced in these various sections: BNS section 2, subsection 8, BNS section 234, false certificate, which Dr. Sameer Sadawarte just spoke about, BNS section 335 to 337, making a false document, that is medical certificate, fitness for rest, etc. And BNS section 318 or 319, that is cheating, something like non-declaration or displaying your degrees or recognized qualification can lead to a case of cheating, or you put up wrong degrees. All that will come under this section now. Doctors are also protected for acts done under good faith. So please put this up, as Dr. Hemant Gangulia always says. Have this printed, put it up in your clinic, and also give it to your local police station. That they cannot do any arrest or any filing of FIR. There are certain sections which they should know about. So done in good faith, done by accident without criminal intention, an act which was likely to cause harm but was done in good faith to prevent other harms, which was done for the benefit of person with the consent, act in good faith for the benefit of a child, acted in good faith for the benefit of person without consent. So suppose a parent is not there. A child is brought with a head injury, fall by the school teacher. There is no parent and there's a huge hematoma inside. The neurosurgeon wants to operate, otherwise a child may not survive, and they take him up. And then the parents come on the scene and say, you never took my consent, but it was done to save the child. So please remember some of these acts which will actually be helpful to us in our practice. Now, protection in criminal cases, there are certain landmark judgments which you should know. One is a Jacob Matthew, which continues to protect us, that an independent, competent medical opinion committee should be set up for the test of reasonably competent person who has treated the patient. No arrest can be done. Higher degree of negligence or gross negligence attributed to criminal liability for higher degree of super speciality. And the benchmark, like I told you, for negligence is the absence of average standard care given to the patient. And we enjoy the privilege of having a difference of opinion between treating doctors or an error of judgment. So please remember a few landmark judgments which were passed. Please read them up. They are freely available. So these are some of the ones which you have: Lalita Kumari versus UP and ORS, others, 2013, which I think was related to preliminary mandatory inquiry before registering an FIR. Then you have Mahadev Prasad Kaushik versus State of UP. Please read that up. And PB Desai, this I think belonged to, I think it was a Bombay hospital case of oncology. So difference of professional opinion does not amount to negligence. So if you're equipped with adequate medical legal knowledge, you know how to fight out your case. And of course, you'll need a very good lawyer to help you and save you. We can also counterfile a case against the police, that is BNS section 248, for filing of false charges of offense against us. And we can initiate proceedings against the police sections 195, which is 215 of BNSS, that is the Nyaya Suraksha, and the 379 to be adhered to. So please remember these things. And if I were to summarize what doctors should do, ignorance of the law is not an excuse. All of us should know the medical legal issues. Be aware of the basics. Please learn to prevent. It's a huge, huge topic. Every slide that we have, every topic that we can talk on is a lecture on its own. Documentation and record keeping cannot be overemphasized. They are our weapons to save us from serious medical legal issues. Please remember this. You do not document, then that thing did not happen. It is that important. Read and keep updated with the latest medical knowledge. All of you read up the BNS, the BNSS, and the BSA. It is available online. Otherwise, there are 3 books which have been published, which I purchased to read. Please read them if you have, or you can buy them, not very expensive, up to 1500 rupees for the set of 3. Read the NMC Regulations 2019, Professional Conduct, Etiquette and Ethics Act, which was previously MCI 2022. Please meet the local police, make them aware of the laws pertaining to medical profession, negligence, be on good terms with the police, and tell them what are the laws existing, because they are the ones who don't know anything, and the mob will go to them and tell them lodge an FIR. The first thing they do is come to arrest you. So please remember all these things, and hopefully I will also read and make things easier and better as and when I can. Thank you.
Thank you, ma'am. Thank you. That was an excellent presentation. We got to know a lot of new things. Maybe there is always a prevailing confusion in the minds of pediatricians about what is a standard of care, what is an average standard of care, and oh no, we should be always up to the mark in giving that standard of care, so that we do not come under the influence of this particular law of negligence. See, we always say that when we give an injection and we cause an hurt like sciatica, it does not automatically come under the aegis of negligence. But if we do not follow certain skills or a basic standard of care, that the proper sterilization techniques or giving a particular injection at a particular site, like, I have seen a lot of pediatricians giving ARV injections, anti-rabies injections into the gluteal region, which is not a choice of the right choice of a injection site. And in such cases, if disease comes into the picture, probably you are liable to get punished under the medical negligence. So thank you so much for enlightening us about a lot of different aspects of medical negligence, and probably it will help us in our day-to-day practice. Thank you again. And
thank you so much. I wish I did justice, and lots to learn more. It's continuing a medical education for all of us.
From IPC to BLS, we thought that it has become more complicated, but not that. You really put it up in such a good way that now we are keen to know more about it and probably follow the standard of care in our practice.
Okay. Thank you, madam.
Yeah, over to you.
Yeah, madam has described various sections in Bharatiya Nyaya Samhita and how doctors are protected, and also we should know few important sections and laws where police may not take immediate action against us. And she has said that be aware of basics. So it is very important, and we should know about BNS. Now I will invite Dr. Hemant Gangolia sir for his next talk, and he is going to talk about basics of medical legal issues, which is very important topic and which will be helpful for us for daily practice. So,
over to you, Dr. Gangulia, sir. Before he begins, I must tell you something about him. He's a passionate pediatrician who has a keen interest in medical legal aspects. I have seen him working so hard on different aspects. He is 24/7 on call. If you have any problem in your practice, you just pick up your phone and call him. He will be there to help you, I know. And he has helped me a lot. He has been helping a lot of pediatrician friends. So thank you so much, Hemant, for all that work that you have been doing for so many years. Over to you.
Thank you very much, Dr. Ganesh sir, for those nice words. And namaste and respected office bearers of IAP Chhatrapati Sambhaji Nagar, under the dynamic leadership of Dr. Abhijit Joshi and Dr. Vinod sir, and all the office bearers of this wonderful IAP Sambhaji Nagar, and my co-faculty, as well as Dr. Ganesh sir, Dr. Prashant Jadhav, as well as Dr. Enu madam and Dr. Nikhil Pathak, and my co-faculty. I think so. Let us start this talk. And I think so most of the things have been covered by Dr. Bela madam as well as Dr. Samir. But rather we will start with my talk. I will start with the first line, which is very important, and everybody knows probably this. But I want to change this. Ignorance of law is not this, but this should be changed to awareness of the law. We should be aware of the laws what are existing. And as medicine vast, law is also very vast. And nobody can know each and every law, each and every section, but some basics one we should always learn. And I always believe what my talk will say, it will speak only the basics of the medical legal issues. What I always feel, if basics are right, probably we have the approach becomes easier, And so this is the important line once we should remember. There are so many types of law there, but preferably we can keep to restrict to there are only two types of law. The statutory law which are passed in Parliament or State Assembly, example, Maharashtra Medical Council, Consumer Protection Act, and another type of laws are whenever any issue happens, goes to the court, and whatever the Supreme Court and the High Court decide, that becomes a judgment law. And that judgment law, force law, precedence law is applicable across the country. So law syllabus doesn't cover all issues, as well as the law doesn't provide solution to all issues. Hence, many issues requires a logical, justified, and appropriate ethical based reasoning as per land laws, unless and until we have some judgmental law when such issues reach the Supreme Court for its verdict. There are a lot of gray areas. Medical legal issues are part and parcel of one's practice. One has to accept it, and one need not get afraid of it. But one should learn, and we should keep in mind every patient is a potent litigant, but at the same time, we should try to restore the faith relationship between doctor and patient, because communication is very important part, and we should be always very watchful. Only one line to remember: if you anticipate any litigation or if you anticipate any complication while treating the patient, please save those papers for lifelong. That is a word to be followed. Or any medical legal issue case, papers to be preserved for lifelong. The change, what is the change has been brought over the years? As Dr. Ganesh sir said, what we used to practice, many case laws has changed our practice. What we used to practice almost 25, 30 years back, it is not possible in today's era of consumerism. What has happened? Faith has been replaced by contract. One has to change with time. Mishaps are the part and parcel of our practice, and we have to accept it and face it. It will happen to each one, and so at some other point of time, and therefore we are all sailing in same boat. So, but then we should learn and get mentally prepared. How? And how this change has been brought? This is the basic case law, IAMA versus VP Shanta case law, which brought medical profession in ambit of consumer. And then this Parmanand Katra versus Union case law. Important line is we don't have any right to choose the patient in emergency state. So if patient come in emergency state, it has to be treated by whatever the ability, limitation, capacity, infrastructure we have, and accordingly to shift the patient at appropriate place in appropriate way, by accompanied by appropriate person. So we have the right to choose the patient in non-emergency state. In emergency state, we don't have right to choose the patient. There's an important Parmanand Katra versus Union case law. This Prabha Manchanda case law is all related to consents. I will come in a minute on the types of consent in a brief. So these case laws introduce all about the consents, whatever consent we have to take in now in today's era of consumerism. Hiranandani hospital case says dead body cannot be held against pending bill. So why? See, believe me, any judgment comes with reasoning. Was there, you have alternative way of recovering the money by remedial measures. Therefore, dead body cannot be held against pending bill. Then this is the important case law of 1.8 crore compensation in case of V. Krishna Kumar versus State of Tamil Nadu and others, where the follow-up of ROP was not mentioned on the discharge card, retinopathy or prematurity, there is lack of documentation, and therefore there happened to be 18-year-old girl being the blind child, and therefore this is the lack of documentation case law. See, always in the discharge summary, we have to write in proper way follow-up. Follow-up way, we should not have the printed follow-up that just making a tick mark on the ROP doesn't mean. It has to be explained, and when ROP has to be done. And similarly, all other follow-ups in the NICU graduates has to be followed properly. And the another case law, 1 crore Prashant Dhananka versus Nizam Institute Hyderabad case, is all related to cross-specialty practice. The message with this case law is that we should stick to our specialty, practice according to the degree which we have, and we should not cross over to the other specialty in practice. So that is an important message with this case law. So moving ahead with this background, I feel always prevention is better than cure, as always said, and I always say these 6 words in galaxy of this all laws or whatever the era of consumerism there, I think that these 6 words application makes the things easier, and probably we makes our approach to our practice much more easier. We have to redefine our practice accordingly by these 6 words. Try to learn the anticipation. What we are going to do in OPD, if you are having office practice, if you are having indoor, what issues are there, how you are going to anticipate the things, that is important. Anticipation makes the person wiser. The important thing is documentation, and it should be justified, informed documentation. The key word in our medical fraternity, this document is very important because it only speaks in the court of law. The third word is communication. Whatever we communicate, it has to be informed one, and that has to be documented. What you communicate with the patient, it should be informed one, we should be documented. So that is the third important word. The fourth word is limitation. Please restrict to your qualification, your infrastructure, what you're practicing, your ability, qualification, infrastructure wise, stick to your limitation. There is a fourth important word. And fifth is, please follow the principle of ethics. Oh, there are 4 principles of ethics. Please respect, do good, do no harm, and equality. And the last and 6th important word is auto introspection. I always feel at the end of the day, we should audit our prescription. We should audit our prescription means what? At the end of the day, we always should go and think about if that patient would have been in our shoes of the dear of our this by thinking that our near and dear ones would have been the shoes of the patient, what treatment I would have advised, what what I would have done. So that is important. So by keeping the patients in the shoes of our by keeping our near and dear in the shoes of a patient is an important thing we should know of introspection. Now coming to each one by one, documentation. See, I will just go through OPD case paper. You should always show your thought process. What is complaint of on examination, impression? It involves the thought process because there are many DDs at that point of time. Example, high grade fever on day 3. So there are so many DDs for that time. But if you write properly and it shows that it is a viral infection, but then always if you write viral infection, the next line of prescription should not be any antibiotic. So if you write URI, then you write only URI, then probably you may write antibiotic. So that shows the thought process, and accordingly your prescription follows. And this is not gross negligence. And on that same fever may turn out to be on day 8 or day 9, enteric fever, whatever. But that point of time, your thought process should be shown by this. So writing these things is very important, not writing just medicine. Indoors papers, always don't write City Hall. It should be always written. Senior should write by own handwriting instead of City Hall. Discharge summary should be Xerox, checked by senior one. Computerization will make the things easier. Then important scenarios of anaphylaxis, sudden death, table death, we should always be competent in handling this because once police gets involved, originals are seized and we are still poor at it. Hence, we are reluctant to call police at first instance. We are afraid of our uncertainty of the given treatment diagnosis. So it is very easy to say anaphylaxis, sudden death, table death. But when it happens, even at consultant level, we get fumbled to carry out the research measures and write properly. The research measures should be written properly. And therefore, I suggest probably we should have rehearsal in doing this. Then, why important? Why the good justified document is important? It is the only evidence which can save us. Therefore, court of law relies on documentation. It should be a good justified documentation. Being busy is not a reason for poor documentation. One has to resort to an assistant if busy. What we inform has to be documented. As well, what we communicate verbally has also to be documented, preferably in the language the patient understands, and the document should be justification and timed one, so that if summoned by court of law, we should be able to justify. And in the meantime, I reminded what Dr. Samir said about certificate. One bottom line regarding issue of any type of certificate is that whenever you issue certificate, the bottom line is that if you are summoned by court of law, you should be able to justify your document or the certificate, then only you issue the certificate. Otherwise, no is the word to issue the certificate. The writing should be readable, capital letter, and this should be justified, informed, well timed. So this all about documentation. I think so one should learn and learn, relearn again. The anticipation is a very important. High time we should learn to anticipate the ringing bell of probable violence in probable scenarios as anticipation makes us mentally prepared as how to go out in such scenarios. The communication skill is very important. How to declare, share the bad news, explain the serious and prognosis, day-to-day status of serious patient, pros and cons of treatment option, and surely seniors have to get involved and not juniors. Often it has been seen. Consent is very important. For any procedure, any invasive procedure, consent is important. Being pediatrician, the ideal consent will be proxy informed expressed consent as the recipient is mine, as their child. Indoor negative consent is very important. Negative consent is equally important, but to mention date and specific time of it. This I will just keep about the this consent. Types of consent. They are implied verbal. What is the implied verbal? Patient coming to OPD, there is the implied one. Expressed or written, that is what we take in writing. Proxy is by guardian in case of minor, that is pediatric age group. Unconscious, mentally incapable. Informed, expressed, written, documented communication. Appropriate format of consent should be there. So what is the ideal consent for invasive act? So I have that consent is always there. We can get from the books. Important papers. What are the important papers we should always in practice? There are OPD paper. It should be in our letterhead, name, qualification as suggested by the NMC. Indoor papers, TPR input-output papers, nursing treatment papers. These three papers, why I had mentioned together, there should be collaborative evidence in that. Whatever the consultant is writing on the indoor paper, that is written on the TPR input-output paper. The findings on indoor paper should match with the findings on the nursing treatment paper as the TPR papers. We should not go, example, if there is fever and if we on the indoor paper it is mentioned pulse rate of 98 and temperature of 102, and in the nursing paper it is written 100, so there is a mismatch between the pulse rate. So that mismatch should not occur. It should, all this corroborative evidence is looked after in the court of law. You believe me, we think that judges don't know everything, but this everything is corroborated, and they, whenever they ask for the papers, they ask for the bunch of papers and they see how you write for the papers. Discharge papers, follow-up instructions, are very important. Transfer referral papers, very important. All this type of papers to be written properly, may not be in the decorative handwriting, but legible handwriting and in proper way. And the word is, and various certificates. I already said about certificates. The word, keyword is whatever you write, there should be justification what you're writing. And that is a keyword for that. A minute, huh? Hello? बाद में कॉल करता हूँ. So these all with justification, there is a keyword for these important papers. So we should write these papers properly. What is medical negligence? Already Dr. Bela madam has said about this, but I will explain in a very simple way. This definition is too complicated. It revolves around all the acts of omission commission. So the doctor should be an average skill. Nothing high skill, nothing. Average skill, standard protocols. What Dr. Ganesh sir said, what are the standard? Standard protocols mean whatever the standard protocols, standard textbooks existing at that time say. That is known as the standard protocols while treating the patient. So he doesn't do the act which was necessary while treating the patient is an act of omission. Thus, the act which should have been done by treating the patient is an act of commission. So it all revolves around the act of omission commission. So we should be careful, and the standard protocols and standard textbooks is the keyword. And because there are so many authoritative people in this Zoom dais, Dr. Ganesh sir is there and Dr. Prashant Jadhav, Dr. Bela madam is there. As a IAP, we should have a guidelines, proper guidelines regarding most of the chapters, most of the things to manage the patient, but that guideline should have the differentiation between the primary level, secondary level, tertiary level. If you're writing guidelines as per the tertiary level, may not apply to the peripheral level, and that may cause problem in the court of law. So the treatment guidelines, whatever is there, it should be as per the strategy, the status of the level of the care, primary level, secondary level, tertiary care. So that just a suggestion from my side, if it can be done. So negligence involves 4 Ds. Whenever you accept the patient, there is a duty towards patient, and if there is a deficiency in duty, which directly results in damages, which are maybe physical, maybe mental, maybe financial to patient or relatives. So essentials of negligence, in other words, is 4Ds: duty, deficiency, directive, resulting damages. These all 4Ds has to be proven by the complainant or the patient who are making the allegation. So burden of proof is on the patient or the complainant. So what are the probable scenarios in our practice which are related to sudden death and trigger factors from mob violence and litigation? We should always remember this thing, and therefore at clinic following injection, which is anaphylaxis, emergency patient coming in gasping stage and dies, sudden death in hospitalized patient, while treating the patient in the hospital setup, sudden death occurs, broad death at the clinic or hospital. These are the untable deaths. So these are the 1, 2, 3, 4, 6 scenarios where one should learn if such thing happens at my place, what I am going to do. And these things we should learn. One message regarding table deaths: don't declare the death unless and until you complete the papers. Before the police come, don't inform the death to the relatives. And there is a VIP syndrome, and there huge billing is there. And one more thing is there: you should be careful of 5 P's. What are those 5 P's? I always say in my talk: politicians, press people, professors or teachers, police or prosecutors. They are little bit tricky patients, so better to just finish up as early as possible in our OPD, and just to be careful with these 5 people. And therefore, anaphylaxis, this ABC treatment of anaphylaxis, we should be as we see airway, breathing, circulation drugs, but in anaphylaxis, A is adrenaline, B is oxygen bag, mask, intubate, C is volume replacement, and if we don't do all 3, then there is sure to death occur. So adrenaline is the important thing. Immediately we have to recognition of the anaphylaxis is very important. Giving adrenaline is very important. Keeping adrenaline at the reach of the hand is very important. And always I say in the most of the thing, if such the anaphylaxis occurs, always the best thing is to inform police. This is the best option. But before informing, documentation, cleaning notes must be done. What injection mode, sequence of event, what resuscitative measures were done, preserve all the used empty, half-empty vials, ampoules, syringe, needles as it is, oxygen cylinder, mask or nasal prongs. Now, here comes one of the question, whether in office practice we should keep all this emergency equipment, emergency drugs and the oxygen cylinder or not. So it is very important because we are giving vaccines. Sometimes we use some injection which may give rise to anaphylaxis. See, anaphylaxis are known to occur with some vaccines or with some injection, but recognizing it and handling it as per and doing the resuscitation as per the standard protocol is not a gross negligence. But in office practice, if you are not having all these things, how will you show that you have done these resuscitative measures? So that becomes the gross negligence. So each and every office practice should have all these things. You never know when the things happen. And always I say in my talks, an ampule of adrenaline a day keep worries of anaphylaxis away. So this one should, and at the 11th hour, we should not serve the adrenaline in case of anaphylaxis. This is all the scenarios which can give rise to problems. So we are coming to the next issue, the important case law. See, there are so many case laws, the judgments come, they changes, they're dynamic. It changes with time and the upcoming judgments. We have more often we have seen the judgment which is given the lower courts are almost reversed at the Supreme Court, and because there is maybe because everything comes with reasoning. And believe me, one more thing I want to say: most of us as a medical fraternity, we feel that judges doesn't have medical knowledge. They give the judgment. Judges don't think on these lines. They give judgment whatever the documents are placed in front of them by the complainant or the complainant or the patient against the accused or the respondent, and accordingly they give the judgment on the documents submitted, on the standard textbook submitted, on the standard protocols pages submitted. On this they decide, and it doesn't come, and everything comes with reasoning. So we should learn to read this law. Still the important ones which can be used for the defense, I always narrate these 4 case laws which are very important to remember, and one should read word by word. Just hearing only on one slide is not important. This is an important case law, Martin D'Souza versus Muhammad Ishfaq case. I will not read, and this is the basic case laws which was given on 17th February 2009, and therefore we are having medical legal protection day for doctors on this 17th February 2009, which was started by last year by CIP in the recommendations of the IAP medical legal group, and now it is a chapter, and it is what it does in, I will go in the short because due to the restraint of time. Martin D'Souza case, not to arrest doctors, not to harass doctors, and referral to committee of doctors. And one more important line is there. We further warn the police official not to arrest or harass doctors unless the facts clearly come within the parameters laid down in Jacob Matthews case law. So this is the Martin D'Souza case law which came on 17 February. Therefore, and this is the judgment. The paragraph 117 mentions all this what I have mentioned in the slide, and this paragraph 117 has to be read in detail. This is a link to go for the judgment, and therefore this we happened, and therefore from last year we are starting celebrating the 17th February, the Medical Legal Protection Day for doctors, started by Ms. on the recommendation of medical chapter of IAP. We thank Chairperson Dr. J.K. Gupta sir, Dr. Secretary Dr. Satish Sharma sir for getting all these things done last year, and we are celebrating this day. And today at same time we are having lots of webinar on this topic. And so this was the case law where this medical legal protection day came. The important another case law is the Jacob Matthew case law. Everybody should know this. The important highlights of this case law is complainant to clearly make out of case of negligence. So burden of proof is on complainant, except where there is a one terminology which is known as res ipsa loquitur, which means thing speaks for itself. That means what? Suppose a mop or what any instrument is left in the body, the things are speaking. Where the burden of proof, onus of proof shifts from the complainant to the doctor. Doctor has to prove now whether these things, why this was done. So onus of proving negligence to complainant only in the cases of res ipsa loquitur, things it speaks for itself, shifts to the doctor. Here, practitioner must bring to his task a reasonable degree of skill and knowledge, and must exercise reasonable degree of care. And again, standard of care is always believed by the standard of textbooks, standard guidelines. Journals are not accepted in the court of law. So here it has to be the standard textbooks. There may be 2 or 3 opinions, but then if the standard group of doctors practicing that, it becomes a standard of care. This is one more important case law, Dr. Suresh Gupta versus Government of NCT of Delhi. This says careless act is criminal only if gross inaction or gross incompetence. Error of judgment, death due to error of judgment or accident should not be taken as a criminal liability. This case is much more important. Then this another case is Kusum Sharma versus Batra Hospital case law. I will not go into the details, but it laid down the principle for determining the medical negligence. It's a wonderful case law. Everybody should read word by word. And it's all the points regarding negligence. We will not go into the detail of this. And this all the points. Now, the another important case laws are related to expert witness. There are so many case laws are there. These are related only to expert witness. Point is absence of expert medical opinion cases. These are cases of absence of expert medical. Expert witness is important. Is a must in consumer forum on behalf of complainant also and on behalf of doctor also. So these are very important case laws related to expert witness. What is the crux of all relevant case law? Standard care, reasonable skill and care. Error of judgment is not a gross negligence, and expert witness is a must. That's important. Therefore, committee of doctors is a must. What is the new law in Bharat, India? Already Dr. Bela Verma has covered. Just I am showing this once more to reiterate. Bharatiya Nyaya Sanhita 2023 has replaced Indian Penal Code 1860, and this is a link to get all the section. Bharatiya Sakshi Adhinayam 2023 replaced Indian Evidence Act. This is the link to get all the sections in one click. I may share this slide also. The Bharatiya Nagarik Suraksha Sanhita has replaced Code of Criminal Procedure 1882. And therefore, I will not go. These links are all courtesy of advocate at Delhi Bar Association, Advocate Poonam Khatri, 30,000 code. And it's very wonderful links to be kept in our mobile. Is very useful. So BNS 2023 has replaced IPC 1860. This is the link we get the section. To get old section of IPC to newly implemented action Bharatiya BNS. And this is the link where you get all section. I will share this link, and it's very easy. When you click this link, you just go to the list of section, and if you click the section, everything it mentions, what is about it, what is the punishment, what is tribal. So it is, and it is much more, it is in 11 languages. So you can get 11 language information with this link. And so this BNS 2023 has replaced IPC 1860. Now I will not go in the detail because already Dr. Bela Verma has summarized everything, but just I will tell, these are the few sections which are concerned with the acts with the consent or without consent in good faith for person benefits in, and these all sections are there. This communication made in good faith, I will not go in the detail, but this section one should remember. Why? In court or defense, this section can be mentioned. If you have not taken consent in emergency, it is not a gross negligence. In emergency, consent is not required, but good faith should be documented. If you're not documenting good faith, then that is irrelevant. So these things, these sections are there. This I already, madam has explained. I will not go in this, all the section IPC related to medical profession. One should remember these sections. I will just, this, only the 2 or 3 things what madam said, which I don't think is right, that BNS IPC 304A was never considered driving. This is a section which has been mentioned. Whoever causes death of any person by doing any rash or negligent act not amounting to culpable homicide. The difference between 304A, which was the applied to the medical negligence before the BNS came, and now it is a BNS 1061. The difference is that, see, just follow my cursor. IPC 304 stated punishment of 2 years or with fine or with both. So many times doctor used to get with only fine. There was imprisonment was not mandatory. So IPC 304A was better than BNS 106. In 106, it has described, it has defined the medical negligence, wherein IPC medical negligence was not defined. And here the punishment is written either this imprisonment of either description 2 years, and the or word is replaced by and. Therefore, here the imprisonment fine both are mandatory, and here it was or. So many times the judges at their discretion used to give only fine, but not this is problem. We will not go whatever is there, we have to accept it, but it's only for 2 years. And regarding this 1062, it is not there, so we should forget, then not to read the 10262. And then this what madam said, and see 1173 is that stringent punishment, but treatment by doctors does not involve this action of the act. So that is not a grievous hurt which is caused by. It is just extrapolating the things, the treatment, because treatment what we are giving, it is in good faith. So there are sections supporting us. So giving rise to vegetative state of permanent disability, this doesn't apply to the treatment aspect of the, this doesn't come in that. So we should not extrapolate this loss of limb, all the with the weapons. And as a treatment, as a doctor, we are not handling weapons. So this should not apply to the medical practice and will not come with that as the interpretation goes. Just few words about violence. I think so. It's a very busy slide, but there are causes of violence multifactorial. What point I want to say is that we should take care of these points, but most problem is the understaffed emergency department, non-availability of medicine and equipments, inadequate care by hospital staff. Emergency department is manned by doctors lacking EM training, and there's a mob mentality. Billing is one of the reasons. So just these are lots of reasons for that. We will skip this, but then practical tips are very important. We should design our workplace properly. Emergency exit is a must. Emergency room should be well equipped. Display of Doctor Protection Act board in each clinical establishment. CCTV use of smartphones. List of emergency phone numbers. Insurance cover. Member of local association. Security. Restrict entry. And if such thing happens, in spite of preventive measures, always trigger the alarm system. Call your colleagues. Inform the police the best option. Involving politician a double-edged sword. One has to take individual decision. Take photographs of damage done to the property. Medical check of injured. Register FIR. Immediately inform insurance company. Never compromise, and to handle delayed reaction of the police. So we should learn to handle these things. And already I have this madam has explained IPCI. These are the WhatsApp messages which were circulating nowadays. These are not the for Hospitals Act. They are not specific act, but these are the BNS section applicable to all citizens of India and public servants which are extrapolated to hospitals. But then this is the sections which are there already. Madam has explained, we will not go, but we can make a banner of this to display at our clinical hospital. I have actually circulated in WhatsApp today. I don't know whether you have gone through that, but I have circulated one of the banner mentioning all the sections related to the violence happening at our clinical establishment act, which we can display in our hospital or clinical establishment act. So just to say this, use of abusive language, causing hurt, injury to doctor, threat to doctor, medical staff, attack on government doctor, government medical staff, forcefully stopping doctor from doing his duty, damage to hospital property equipment. This should be displayed, and defamation. This should be displayed in our clinical establishment. Mob attack, forceful entry into the hospital. So these are the section 189, 190 of BNS for unlawful assembly. And then attack or harassment to lady doctor. There is separate 74, which is term 1 to 5 years in. So there's different punishment: cognizable, non-cognizable, bailable, non-bailable, and triable with judge. So it all depends on the sections, subsections of the offenses, and accordingly decided whether it's a bailable, non-bailable, cognizable, non-cognizable. Not all sections say it is a non-bailable or bailable. So it depends on that. So this is a display what I was speaking of it. I have circulated this in a WhatsApp group. You may just make a copy of it and just can put in our clinical establishment, clinics and hospitals. Display of the Doctor Protection Board is very important, and it was implemented in Maharashtra 2010, and so everybody should have this board in our clinic establishment. This is from our Karjat Medical Association. We are displaying in all clinics. It has all 4 sections. To summarize this Doctor Protection Act, Section 3 mention act causing damage, loss, violence to medical establishment is prohibited. Punishment imprisonment to 2 years and fine 50,000. Section 5 says offense is cognizable, non-bailable, tried by first-class judicial magistrate, and compensation of twice the amount of damage the Section 6 mentions. So these are 4 important sections of Doctor Protection Act 2010. This we have developed in Marathi, and it's a blank one which I have circulated in the WhatsApp again today morning. You can just take it is a A3 size. You just can have the printout of that, and otherwise there's a blank space I have left. You just can put your association name, you can put your other things, and if you want a copy of this, you can get always from me in the CDR file format also, A3 print size also, so you can be able to edit as per your choice, as per your thing. So this should be displayed always. Why to display all things and why to know this section? Important thing is that whenever such thing happens, and if we do FIR is done online and is done from police station. Just follow my cursor, what I'm saying. Whenever the FIR is done, it is always done under acts and under sections. And if and many times police stations are not aware of this Doctor Protection Act. So we should have a soft copy in our mobile, and the FIR is always lodged under the acts and the sections. So, and when this everything is done and when charge sheet is filed, again, see, I have highlighted the acts, and when the charge sheet is filed, again in charge sheet number, again the 4th number column is always act and the sections, and therefore again here it comes the this is one of the case which happened in our Karjat Taluka, and so we have to do FIR, and the police were not aware of that, and police asked me that time. I just gave it was in my mobile. I just WhatsApped him, and just then this was done. And remember one point, why I am explaining this, because once FIR done, they give a copy to you to read it, and then they have to sign it, and once you sign, then it is uploaded. So we have to read and go through everything. If nothing is mentioned, you always can say to the police station, these things are missing, this thing is not there, please, one can write. But we at the same time we should be humble and gentle, not bossing them, but asking them in a polite way. So final charge, again it comes in the acts and the section. Then one of the important slides, this is from my talk of the mob violence. You should be always a member of local association, and we are always there. But the most important point is we should have a rapport with the local police station. We should have a courtesy meeting. Whenever the association office bearer changes, have a courtesy meeting with the police station. Meet them, introduce ourselves, introduce this is the president, this is our secretary, this is our treasurer, this is the office bearers of our association. We always go to police station whenever the problem occurs. Make a point to make a courtesy meeting. You should always have a good criminal lawyer. But here I want to differ. Our profession is the only profession we tell all the secrets of our profession. Otherwise, this lawyer also never tells their secrets. We should be very careful, but if we are having very good friend, we should have a good criminal lawyer. An excellent medical legal backup, expert backup is very important to even if there's a good criminal lawyer is there, sometimes they lack in the medical knowledge. So this is very important to them. Now, what are the legal forums perspective from doctor's side? What are the options available in the case of mishap? Always remember, informing police, call your colleagues, call upon influence politician is a double agent, and financial settle. Most of the doctors, they want to get rid of the problem as soon as possible. Hence, most of them resort this, but this trend is an invitation for all the time. And on one Supreme Court of India judgment law is there. Do not give any cash or check to the patient in an out-of-court settlement without proper written agreement, that is known as consent terms. So if you want to settle properly through the court, not in this way. There is a consent term word applicable where the both parties, in presence of lawyers of the both parties, make a paper in front of the court and get amicably settled. So the out-of-court settlement is itself a topic which will, and through the perspective of patients, patient may go to police station, they may go to criminal law courts, they may go to consumer forum, they may go to the other authorities, medical council, NHRC, National Human Rights Commission, civil courts is less likely. Other authorities they can go under various act, chief medical officer, Ministry of Health, Lok Adalas, and these all things they can go. But the point what I'm making is that any forum, let them go. One should remain peaceful. Only problem is the police station. When FIR is there, we don't have time to make papers. So one should learn the proper documents. In other all things, we have time to submit our reply. We get notice. We get 15 days time to reply this notice reply. So we have time. But in police station FIR done, they can come and seize the original papers. So we should learn to document properly. And so this is the problem with the FIR. So these are forums where the patient can go. Then one more thing I want to important slide, one of the basic thing. Whenever any mishap happens or any litigation you anticipate, please immediately discuss the issue with your seniors, with your professor, with your close friends. Research the literature. And what is the literature for you and against you? Preserve the papers and make the appropriate documentation. Why? Period of limitation act is 2 years. In consumer, if any incident happened, they have 2 years to file the complaint. In criminal, it is 3 years. So there's a time period, and most of the time the courts condone this period also. So if you get notice after 1.5 years of the notice, you don't remember what the incidents occurred. So always try to write the papers in a chronological order. So whenever anything comes and whenever you anticipate this litigation, please preserve these papers. I will say most of the time it should be the lifetime. What are the aggravating factors? Criticism by own colleague is important. I will not go to the other causes, but medical jousting. We as a friends, our peers, we should never do medical jousting. We should not criticize our own colleagues, and that is a 43% which give rise to litigation. Huge percentage which gives rise to litigation. And I come to my concluding, and still this shadows of era of consumerism laws. But the bottom line is, if we have honesty, transparency, punctuality in our professional practice, we can overcome the stress of our practice. So this is the 3 key words, I think. So we should maintain honesty, transparency, and punctuality. And to summarize, proper documentation is recommended. Follow standard protocols. Manage the complication as per standardized recommendations. Keep contents of emergency kit at hand. Oxygen cylinder, laryngoscope, bamboo pack must in office also. In mishap, police information is the best option. Call colleagues for help. And mishaps are the part and parcel of practice. Let us accept it, face it. We should not grumble, but we should learn to how to go about it and anticipate the things. And still, this research from Global Trust done index, and still the दुनिया में सबसे भरोसेमंद पेशा डॉक्टर ही है. See this 2022 percentage of doctor 58%, and then scientists, then teachers, and everything. And I will not just quote it because it is in. See this last. This is they are the last people on for bharosa. Follow my cursor. So I will not tell in this dais. So this is still I think so. Doctor doing medical profession is still noble profession, and we should. It is not for making money, but medical is a passion to practice and to serve the people. And just to summarize, by this is a letter which has received from Indian Academy of Pediatrics, and I hope so. Aurangabad, this Chhatrapati Shambhaji branch must have submitted. This is the letter which has the maintenance slogan theme they already mentioned, and this is the activities one can done. But most important, this you must have submitted. I believe this is a memorandum which has to be submitted to the police authority by making the changes or editing the letter. And this was drafted by Dr. Mahesh Baldava sir, Dr. J.K. Gupta, and this was drafted and supported by Satish Sharma. This was drafted last year, and this is a memorandum which has to be submitted to all police station, IG, DIG. So if you have not submitted your branch, please make a point in 1 or 2 days. As office bearers, go and please make this copy. You may send it by editing it. I may correct it if you feel. And then this is the press release. Press release in English, which once again is been drafted by Dr. J.K. Gupta, Dr. Mahesh Baldava. And this press release, what you can do, you can make an article of it. As in IAP Raigad, we are forming an article which should come in the local newspaper, and this local newspaper should be aware of this thing. And this is very wonderful. I will not read. You can read for yourself. I have circulated once again in today's WhatsApp message. So this is press release in English. This is in Hindi. And in Marathi, we are drafting at our IP Raigad level. Dr. Dabarkar sir and Dr. Rajendra Chandorkar are drafting this in Marathi. If they get drafted, I will really forward to you to be circulated in a local newspaper. And last, to end the slide, no gadget, what Dr. The Swami Vivekananda said long time back, no gadget has been developed which can predict 100% correct medical prognosis and can assure 100% medical recovery. But with experience, skills, logic, a doctor can try to find a means of treatment to avoid mishap, but with limitations. Each and every time it may not work or will be right. Therefore, the doctor should not be treated as God, as well at the same time not to treat doctor as an accused. So long time Dr. Swami Vivekananda said that, and therefore I will stop here. Thank you very much.
Thank you so much. Thank you indeed. As usual, wonderful presentation. I can happily use the phrase that you quoted just now, res ipsa loquitur. That means things speak for itself. So I can use this phrase for your presentation. Your presentation really speaks volumes about your authority in this particular subject. Thank you, sir. Always to the point, precise, crisp, and elaborative as well. Indeed, we got a lot of take-home messages today. And to go further, there's one bad news, I would say, that Nikhil is stuck up in an emergency, so he won't be able to, be part of presentation. So I think this became a concluding part of our session. Over to Dr.
Ganesh.
Yeah.
Ganesh, you can ask for, there are a few questions, I think, in the chat box.
Tell you to look into the chat box and
Dr. Samir, Dr. Ganesh, we have a personality from Dr. A.K. Manglik. We can invite him for his comments. He's a person.
Manglik sir, please unmute Dr. Manglik.
Oh, I'm just seeing his.
I saw him from a long time. He's actually listening very carefully.
Inputs into the chat box.
We have today 25 seminars ongoing across India. And thanks that Dr. Manglik sir is a very senior.
Is a big.
Thank you so much for giving me the opportunity. It's been a wonderful 2 hours, and I just commented that in the chat section.
Yes, I just read
that. The 2 hours have been very well spent, and anybody who listened to all the 3 talks will be really benefited. And I'm really thankful to all the pains taken by all the 3 speakers to collect all the data. I mean, this is mammoth, the work done behind. People who just listen to those few minutes, maybe for the 15 minutes or 30 minutes or half an hour or an hour. Sometimes people say that concentration level goes down after an hour of hearing, but you can imagine the amount of time spent by the speaker preparing the talk. Really, Dr. Bela Verma, Dr. Gangolia, and Dr. Samir, the amount of time you must have spent preparing these talks is really, really mammoth. Thank you again, and I'm really really grateful to you for having organized this during this week and this day. Thank you very much.
So we have Dr. Prashant Jadhav also with us. He is also a keen specialist in medical aspects. If Prashant, are you there?
Yeah, I am very much there. and I was listening to all the talks, and really let us give hats off to Dr. Vinod and Dr. a stalwarts of medical legal, head of the department, Grad Medical College, two intensivists. Unfortunately, Nikhil got stuck up, but these were the talks were much more informative, useful than attending one full something in a pedicon. It was beyond that, I would say, and as we all know that. Medico legal branch, even though many times is not given much importance, but every individual practitioner is at the stake of facing some or the other medical legal issue every day, and that is why I think the attendance was there, everyone was listening, and the way Dr. Bela ma'am, Dr. Samir, and Heman Gangulia sir has spoken and given us the knowledge and wisdom. It was not only the knowledge, but knowledge and wisdom. It has definitely must have allayed the anxiety of many of the doctors, and we should be in touch with all these stalwarts and medical legal chapter as well. Samir is doing a wonderful job connecting with all and increasing the membership. And again, I'll say I appreciate all the speakers and office bearers of IAP Aurangabad, Chhatrapati Sambhajinagar.
So Vinod, can you take few questions in that box?
Yes. So, Ganesh, should I read the questions?
Yes, yes, please read the questions.
Okay.
By Dr. Raju Gujarati,
There
sir.
is.
Most of the questions are put by Dr. Vinod only. So, shall I read on your behalf or?
Yes, you read for my behalf.
Yeah, he has presented queries. Just a minute.
Till that, Dr. Raju Gujarati has given asked one question: what is the maximum days we can issue sick leave certificate? So I will ask Dr. Sadavarti Samir sir to answer this question.
Please once again, what was the question was? How many maximum days we can give?
Sick leave certificate.
So as a pediatrician, as a common pediatrician, you can give only up to 15 days. And after 15 days, you have to again see this patient and try to find out, rather than just giving certificate, try to find out the reason why he still requires certificate. Is it for his own purpose, whether it's for disability, or you may send this patient to the more subspecialist or to the government hospital or to the civil surgeon to get the more certificate. Like suppose for civil surgeon, he can go up to 40 days, or even a medical board or director can go up to even 6 months if severity is like that way. But as for a common pediatrician, it is 15 days. You should not give more than 15 days. You may not be possible for you to be watching continuously this patient. And if it's not coming to you, obviously you must not give that certificate. Parents may come to you saying, child is sick, child is at home. There may be possibility that something has happened to the child. We never know. Unless you see this patient, again confirm yourself that it is the same child, same identity mark, same signatures. Check the papers once again. Continue this job till the time is coming every 15 days, not more than 15 days. But
there is, thank you. There is one query from Dr. Raju Gujarati from Mumbai, that can patient or patient's relatives take photo of the indoor file while being admitted?
So before that, Hemant sir wants to add something.
Yes, sir, please. Yes, please.
See, the common scenario which happens while giving the certificate, illness certificate, is that from 5th to 7th, he has taken treatment from Dr. Samir. And from 7 to 11, he has taken treatment from me. So he asked treatment and the certificate from 5th to 11th. Never give that way. You give from 7 to 11 only. And you ask the previous doctor to give the certificate for the earlier days. There is a common tendency occurs. So we should not do that.
Okay, sir. Okay.
Yes, sir. The question was raised was, can patient take photos of the indoor files while being admitted, or the relatives? Yeah. Anybody?
question here is like why he wants that picture. whether he has no trust, whether he has trust, but whether he wants some second opinion. The best
Yeah.
thing what we can do is try to find out the motive and reason. That is the most important thing. Because sometimes you might be doing your great job, parents may not be knowing this. So either somewhere you are not doing proper counseling, try to counsel. At the most, if he wants, you can give him certificate, like suppose investigation chart, Xerox, and you give the brief summary of whatever mentioned, because most of the times we are having 15, 20 pages for just 2 or 3 days admission. You don't need to write each and every part. You just write the important saline features and give it to him. And ask him very specifically, if you want second opinion, tell him that we can give him help to approach particular doctor, or even from our own hospital, maybe from different hospital. Patient have right to get the reports and getting the summary. We cannot deny this to the patient. We have to give it to the parents. But no photo.
What Samir has said is theoretical, but practically doesn't happen. Practically, most of the time they take the photos of the papers and these things. So practically, the things are different. Yes, what Samir said is absolutely right, and they have the right to ask for the papers, but that is by means of application. And I want these records. And one more line: if they demand any records of any time, as any first MCI used to say 72 hours, but in recent guidelines as per NMC is of 5 days. So within 5 days we have to give as per latest NMC guidelines. But what Samir says, so the point is that they can take, and most of the time it is happening. In the practically they are taking the photos. And what is the problem if they take photos? Then when you sometimes what happens if something mishap happens, and if you are a little bit manipulating the papers, they show that photocopy that this was the photo I have taken. Now this how is this has come? So that becomes a fabrication of papers, and in fabrication papers is itself an offense. So best thing is that see, you make a hospital policy. What hospital policy is there? But still, if the hospital policy is existing, but still you cannot prevent this from taking photos of the papers. Yes. The best thing is that we have to document properly. That is the only thing which we can do it. And if they want to take, let them take. Officially, you tell no, but that is not possible. It's not practical.
Can I say something, sir?
Yes, boliye.
Yes, ma'am.
Sir, actually, they do ask for case paper, photos, Xerox, and we know they're going for a second opinion. Okay. Yes. What we tell them is you cannot take the photo. I will give you a summary of what's going on here. Yeah. That's it. Write it on a separate sheet. What is a complaint? What is your diagnosis? Working provisional diagnosis? What tests have come and what treatment you're giving. Never give them the Xerox or photograph.
नहीं ना मैडम, मगर वो निकालते ना, क्योंकि हमको खुद फोटो आते हैं ना तुम्हारे हॉस्पिटल में से, ये ट्रीटमेंट चालू है, बराबर है क्या?
So then that is wrong, na?
So that is wrong. It is wrong, but it comes. So the point is, what you say is absolutely right, 100% right. But therefore, the reason is that we should always document and write properly. If sometimes in case they take, it's okay.
They even ask us, ki our family friend is a doctor, he wants to come and visit here, see the child. We say call, let him talk to us one-to-one. So instead of having misunderstandings, better to explain to them yourself. More often than not, the problem is solved by talking directly.
Okay. Sir, one more question is that sometimes patient is admitted with us in emergency situation like seizures or epilepsy. At that time, we admit the patient immediately and then start treatment. Afterwards, father comes or some relative comes because patient is brought by some nearby person, some neighbor sometimes, and then father comes and then he refuses to do signature on the indoor paper, and we're already giving the treatment. Then what should we do at that time?
Anybody answering?
Ganguly sir, you go ahead.
No, what you said, see, in emergency, when the patient comes, in emergency can give the treatment without any consent. The good faith is documented. But once the emergency part is over, then we have to take the signatures that in emergency we did this thing because he demanded that saving the life was important. But now to continue further treatment, we require signatures, we require a consent to go ahead. If you are not giving, then we cannot proceed with the treatment. You have to think of the alternative way of treatment or alternative way of hospital. That is the way to go. And most of the time, you should always involve the decision makers as well as the both mother and father, the parents of the child, as well as the decision makers at a right at that time. And the most important one thing nowadays, it is this era of smartphones. You can always, or a CCTV, you can just go ahead with the audio video recording of this whatever you talk here, and you have to mention it. We are recording this talk, what we are asking for you, and whatever you are having your say, I will listen to you, and what I want to say, you have to listen, and then that should be on the record. That is the way to go.
Sir, but sometimes what happens, relatives, mother comes and she says that his father will come and he will say do the signature, or some another important person in the family will come. Till that you continue treatment, he will come after 6 hours. He is out of station or something like that. At that time, according to my knowledge, though I am not a knowledgeable person in this, somebody told me that you have to take the signature of the two staff and some another patient which is admitted in your hospital, that relatives. So these are the, we can say, sakshidar for this.
So there is a way for that. If she's not giving the signature, that is a negative consent. You have to take that you are not giving the signatures. Now still on him, she will not sign on that. So you should write on the paper. He once the emergency treatment is done, to continue the further treatment require the signature from the mother, but she is not giving. So you can take the these two patient
Yes.
witnesses, the signatures of them, not your staff, not your this. That will not work, because that will the biased witnesses. So that will not work. So you have to take the two. And now you think of in which setting you are practicing. If it is a hospital practice, corporate hospital or the government hospital, you have to inform the medical superintendent or whatever the in charge of that hospital or in charge of that unit. That suggests you have to inform them, and accordingly they will take the action. And similarly, in a joint hospital where you have the these trustees and this, then again you have to you will be having some authority. You have to inform that authority. If that also doesn't work, then you have one more option of informing the police. Once I have to just is the information. You are not complaining, but you're informing the police. If I have done this, we have done this emergency. Now they are not giving the signatures. We are continuing for the benefit of patient. This may be taken into notice by your police station. That's all. This should be in the writing, submitted to the police station with their signatures and the time, date, and the badge number, whatever it is. That is the way to go.
Okay, sir.
There is one more thing to it, if I have to add it. There are two ways to deal with it. One is, if you are doing a life-saving procedure, law gives you permission to go ahead and do the procedure without taking a consent, because it is in the interest of the patient, because you are doing a life-saving procedure. So in case of non-emergency situations or non-emergency procedures, you can always wait for the father to come, convince him, counsel him properly. See, there are two reasons why he denies the consent. One is because he hasn't understood what you are going to do with him. That's the thing. And probably he has not understood the risk and complications arising out of that procedure. So it is your way to counsel him in a proper manner so that he understands about the situation, why that particular procedure is so important for that child. Then he'll absolutely give you a consent. And if he is not giving, then what Hemant sir has said is the way to go ahead.
Dr. Ganesh Kulkarni, what he said is right, but sometimes in waiting, because we have stabilized the emergency patient, but he may not know at what point of time it will deteriorate. So what is that period of time, waiting time? We are not sure what waiting time. So it is always best to do this thing. And if you're judging it properly, that nothing will happen in the next 5 hours, then you can wait. But we cannot predict. So there is no point of prediction in that.
Yes. Abhijit, you can ask next question.
No, I already read whatever you had asked. So I think if somebody wants to ask anything.
I will ask questions. On OPD paper,
Yes, sir.
what is the OPD on OPD paper? What are the minimum things you should write? And one thing I forgotten, what Samir said, because while I was listening to him, there is a format, medical certificate guideline 7 mentioned in the NMC, how to issue the illness certificate. That one should go to the NMC and get that thing. Again, prescription format, how the paper should look. Guideline, I think so 2 or 4. I will just see that explain the NMC about the prescription format. So again, that we have to take the note of it. So OPD paper, what one should write?
OPD paper, as he has nicely described, the name of the patient, age of the patient, sex of the patient, then
No,
all the
our means as a doctor, what should be there? Name, qualifications, and what time
A4
and
size. It should be A4 size paper, I think, first prescription paper, according to my knowledge. Then
name should be written. I will just
yes,
because we
yes.
don't have time. Name should be written. Proper qualification which are recognized by NMC should be mentioned. If you've even done any certificate course which is not recognized by NMC, should not be mentioned. It can be mentioned that you are trained in this thing. So that way you have to write. Then timing should be mentioned properly. Don't write 24/7. Everybody knows now by this time. If you are writing 24/7, then you should be available for 24/7. That
Yes.
should be mentioned properly. And one more thing, suppose you have gone somewhere out, and then in absence, who will you will appoint, or you will keep the locum? The should be of the same qualification which you are, or in the same pediatrics means MD, DCH, it will do. Same qualification should keep. And suppose who are doing OPD practice, you have seen the patient in the morning vomiting, loose motion, and he gets the great dehydration in the evening where you are not in around. So what you will do? Because they are treated in the
we
morning.
will send the patient to some other doctor on phone. We will tell the patient
Yeah,
to
that is
go to
there.
some other
But
doctor.
best thing is OPD paper. Besides your time, whatever is mentioned in the OPD paper, if you are not there, what are the alternatives available? Alternatives phone number, alternative hospital number, hospital
Yes.
or doctor's name, that should be mentioned with the phone number.
Yes. Yes.
Yes, sir. Sir,
Definitely.
one more question from my side only. If sometimes it happens that baby comes in the NICU immediately, premature baby is there, and it is decided that we have to give the surfactant within half an hour. Surfactant is somewhat costly, and relatives are not ready to bring it immediately. But we know that surfactant is very important, and if we give it in the time, it will save the baby's next complications. So at that time, if the patient is not ready to bring the surfactant or some important medicines, then what we should do?
Madam.
Sir, this happens very often in government hospitals. So we do try to procure. Sometimes we are under the JSSY now, the Janni Suraksha, this thing. We do have surfactant available. So in that we do it, but maybe other medications or tests cannot be done. So the basic tests are done in-house. Apart from that, if we need, and at night we have no social worker to help us, it is absolutely necessary, then we doctors have pooled in our money and given if it is required. There may be some things which may not be possible, say a CT scan or a sonography, patient is bad, then we document on paper that patient is unstable, cannot be transported to the next building. More often than not, basic amenities are available in government hospital. I think this would be a problem in the setup for private when you have a non-affording patient. Then it is mandatory you stabilize the child, put an IV, start oxygen, give some basic IV antibiotic, and you then transport them ahead to a higher referral, if you feel he's going to need a lot of things. So a government hospital, a municipal hospital is the next best option. But you have to inform all this to the parents and then send them ahead after stabilizing, doing the basic. So for a neonate, you may have to put an NGT, put 10 cc of dextrose. He should not have hypoglycemia, he should not have hypoxia, give a shot of antibiotics. So this may be a little charity on your part, because you know he's not going to repay you for these drugs. That is what I feel. You cannot leave the child untreated. Basically.
So one thing what Madam said is about the government setup. But in private setup, this is a huge problem which comes. So that depends on the communication skill. Means communication of surfactant is essential. The one way Madam suggests that transfer it appropriately. The other way, if you have good communication skills and if you are able to make them understand that this costly drug we are giving, in spite you are not bringing, but you have to pay for that, and this is the amount which can be written or taken in writing. This we are giving for the this good faith of the baby. That you can do, and you should be confident that that money we will get it. One more thing, if you're not, then this is the way to go ahead. And one more thing, one incident happened which I don't remember, but what happened in good faith, the surfactant was used by that doctor, and what they did, the sister gave the bag to the patient to replace that surfactant, and incidentally that patient noted it was the expired surfactant, and it went to the medical legal case. So this may also happen. So if you ask for replacement, be careful what you're asking for replacement, and that should not be done. So that it was the expired. We know even though it is expired, but it works. It doesn't loses the potency. It doesn't cause any side effect. But little bit some what do you say? The effect may be less, but it works.
Sir, but here I just want to ask, this newborn must have been born somewhere. If he's come in RDS within 24 hours, 6 hours, needing surfactant, he's an inborn neonate, no? Who referred like this? I mean, it's not a house delivery, home delivery. Dr. Vinod?
Unmute.
Though, madam, though it is some from gynecologist, patient child is coming to us. So one point is that now most of the relatives say so it is so too much of preterm baby, so we don't chances of survival are less. So relatives sometimes are reluctant to bring the medicines. Even then,
No. What I'm saying, if it's a preterm delivery, it's the onus of the OBGY to refer the mother in utero to a central government hospital for delivery. He's going to need an ICU. You cannot give surfactant in the ward. You need an NICU for it. That's what I mean to say. So if this is an in-house delivery, there will be an NICU or a neonatal care unit. If it is a home delivery and they have brought it to you, then you'll have to do charity or refer ahead, is what I'm trying to tell you. But OBGY has the onus of knowing it's a preterm delivery going to happen, that they have to refer that baby in utero with the mother and not conduct the delivery in their center. Because this child will need immediate referral to a NICU, which could be so many kilometers away. It happens. Father brings the baby in ambulance to JJ. Mother is still there with cesarean. Okay.
yes.
But ideally it should be in utero transfer, because mother needs to be with the baby whenever. And if it's a government setup, many things are taken care of.
This does not happen in normal practice, madam.
No, you will have to change certain things. Because it is a combined thing. Neonates are not just neonates or pediatricians' responsibility. It is OBGY plus pediatricians, and we are not neonates. We have not done neonatologists. We have not done DM. Please remember that. But by default, we are all doing neonatology. So this much you will have to change in your setup. And secondly, my one question to Hemant sir. Sir, you told the case of an 18-year-old with ROP. How did that parent come at 18 years of age? How long can documentation be kept? And whether this case really holds any water? Because taking time to know that this blindness is caused by ROP. How did that even get diagnosed at 18 years? And how will the doctor prove? Because documentation nobody will keep for 18 years, even by law.
No. I first I will say interestingly, in most of the talks, what I say, you always should keep your budget for the non-payment of fees, non-payment for such things. So that is part and parcel of our hospital. So we should learn to take the advances properly in a proper way. Still the advances are not there, but that is a part and parcel. So there will be some amount of percentage of non-payment of fees that has to be taken for granted. And though the case law, which I said, dead patient held cannot be held against the non-payment of the fees. And such what the reasoning was given by judge was that you have alternate remedy. You can go to civil court and get your payment done, but that takes long time to come in the court. So we should forget that amount and just forget that amount. Coming to your question, Dr. Bela madam, it was not 18 years he diagnosed. The judgment when it came, it was that time she was 18 years. So it was not 18 years. That case
so
was.
the complaint was made when?
So that complaint, it was when it was the diagnosis, when it was age of 9 or 10 months.
9 of 10 months. And now the child
That
is?
patient was delivered in state government hospital of Tamil Nadu, and from that the discharge was given from the state government hospital of Tamil Nadu. It's shown to the pediatrician of Madurai, and from Madurai that patient came to Mumbai to show the to pediatrician. They said it was ROP. From Mumbai, the patient went to US, and US said it was a grade 5 ROP. It cannot be treated now. If it would have been grade 3, then it would have been treated by laser. That was this consultation was given by at US, and therefore when he came back from there, he filed the court in this. And so this compensation all came by keeping the mind that time the age of the was 18 years, so that compensation was calculated, and that it was went to 1.8 crores.
Okay, and sir, regarding cerebral palsy, again, which is taken as a negligence, the resuscitation was not proper, the child has become CP. So it was like hypoxic neonate, perinatal hypoxia. There also, I think we have to be careful because there are antenatal factors also for in utero hypoxia, where the OBGY comes in place. So improper technique, bag and mask may not really hold true. It may be in utero hypoxia or a delay in the delivery or a late section taken up. So such cases also must be happening, no?
Yeah, they do happen, but whenever such cases come HIE, you should always document the things. What are the pros and cons of saving this child, and everything should be explained to them. That is there. Nothing beyond that can be done. But that will not come into the means whatever the standard line of management you are doing, and it doesn't prevent from going to cerebral palsy. It's not fault of doctor. The treatment part should be as per the standard protocol. But at the same time, if you are having an infrastructure where you're managing HIE, this case, birth as the case, and if you don't have the tertiary care facility like ventilator and CPAP, then keeping this thing in such setup will be problematic. It may be negligence.
Thank you, sir. I think, Vinod, they have given a proper and crisp elaborative guidance to all of us and asking them more questions because these are very tricky situations. So that will be a burden for them to answer to each and every question. And that will be definitely an act of omission of the food, which is highly expected at this point of time. So rather than
Yes.
omission, we'll have commission of food. So I think they are always there to help us out in any tricky situations like this. So we'll be in touch with them. And sir, yes.
Sir, before you conclude, one take home is very
Yes,
important.
yes,
What
yes,
I
sir.
realized from my practical experience, if you have any problem, please contact the medical expert or lawyer, whomever you believe, as early as possible. Many times I get call when they have already submitted a statement to police station, when they have already submitted a statement to the court, then nothing can be done. And most of the time they submit up papers also. If it is done, nothing can be done. So then, because there are so many tricky questions police ask, which we are aware of that. So we have to go accordingly. They are very, very smart people. I can say that. We think we are super, but they are also super.
Okay.
Thank you very much.
Yes.
Abhijit,
With
vote
this,
of thanks.
I would like to really from my heart, I would like to thank everybody of you, Dr. Gangulia sir, for giving an excellent talk. And I will definitely remember that your quote, like an adrenaline a day keeps all your emergency anaphylaxis cases away. So I will never forget that. Dr. Bela Verma, madam, that was it was very nicely given talk about all the laws which are out of our syllabus, but we'll try to get the books and read it again and again. Dr. Samir Sadavarte, those are very simple things, but which are day-to-day practice. They are very important in day-to-day practice. So we'll keep everything, and we have been following this, but a lot of learning and relearning was important. So hats off to your knowledge and hats off to your you were never short of words while speaking about all these difficult problems, and you were never short of words, and it was so fluent and elaborative. So I thank you all from my heart, and of course, Dr. Ganesh Kulkarni for moderating anything which is given to him. So he has again shown his mastery in every field of pediatrics. Dr. Nikhil Pathak could not he in because of emergency, and that was, I think it was worth attending the emergency than to attend this webinar after listening to all these things. Dr. Manglik sir, he was there and he attended it. Dr. Prashant Jadhav as MMC observer, I also extend a vote of thanks to him. And not to forget the contribution of the medical legal chapter in the form of President Dr. J.K. Gupta sir and Dr. Satish Sharma sir as secretary. So their contribution is not to be forgotten. And really, it was a very learning experience for them. And to tell you that I was always keeping an eye over the count of the participants. It never touched less than 100. So it was all the time there. Like I didn't guess what the count was on YouTube, but it was always 100. So it was very interesting, sir. Thank you very much from the team of IAP Chhatrapati Sambhajinagar. Dr. Vinod Totle for his excellent skills in. He has very technical support, and there was no audio visual any lacuna in this. So congrats, Vinod, for that. So thank you, everybody, and let us see you very soon, sir. Yeah, thank you.
Okay, thank you.
Thank you.
We would also like to thank President and Secretary of IAP Medical Legal Chapter. Yeah.
Yeah, that I already. Yes.
Yes, sir. Thank you, sir.
Thank you. Good night. Yeah, thank you.
Good night. Good night.
Thank you, Team Chhatrapati Shivaji Nagar,
Thank
Sambhajinagar,
you.
that for giving opportunity to us. Yeah, thanks everyone.
Thank you, sir. Thank you. Huh? Okay, sir.
Good night.
Fine.
Thank you,
Good
ma'am.
night. Good night.
Can you stop this on YouTube Live and all?
Yes, yes. I'm meeting the end. Yes. Huh? And when ending the
Stop the
meeting now.
YouTube, please, first.
What, sir?
Stop the